responsibility that we actually is bound ourselves to certain numbers of the code of ethics, as well as we are bound to our professional ethics and as well as the law. Bear in mind, this is the whole basis of our profession. And then, Alhamdulillah, is we are in the IOM. We are having a champion in terms of the Islamic ethics, as well as Islamic practice in the profession. So before I go through all the slides, everything, so or we have to understand that the Islamic value is a universal value, and then can be shared by everybody. This is things that maybe is important for us to understand, because some of us maybe, oh, I am not a Muslim, but the ethics and the professionalism that from the view of Islam actually is quite universal and can be accepted by everybody. For the purpose of our teaching today, I actually is try to in 1 hour to actually is celebrate in terms
Sorry, Prof, are you still with us?
maybe we encountered. Okay, then only maybe we can actually is a share what is the resolution or things that maybe we can do. Okay, so the foundation of the ethics goes to the good behavior with yourself and then with the people surrounding you. This is actually is shared even by the Western ethical structure, which is we always use for a long time. And then the Islamic ethics are based on the Sharia. They add on the principle of the good behavior to the Sharia, means that we emphasize on humility towards the Allah Subhanahu wa Taala, or to the God. And then most important for us, when we do something, we need to consider what is the consequences before our action taking place. And then the obligation of a doctors, we are today, and the hospital to the patient. This is the basis of the community, or we call it the ethics in the hospital community, as well as in the medical fraternity. And like I mentioned just now, medical profession and professions ethic is a universal code that shared by everybody and applied to most or multiple groups of a health professional or health institution. And then the sense of a share of a responsibility and ethical commitment across the globe, and then healthcare community. This is the foundation of the ethics that we are talking about. Then in Islam, there is what is the roots, how the ethics come into the place. The first principle is about the fitrah, which is the innate nature of a human being, good or bad quality. For example, when come to the killing of people, I think across the humankind, all people, even the animal also, they know that the killing others actually is a bad qualities or bad things to happen. This is a fitrah for everybody, and then this is a universal things that that happen to the whole mankind, as well as the animal kingdom whatsoever. And then the second part of the roots and the pillar of the medical ethic is the akal. Akal means our reasoning, our intellectual, the function as distinguishing the right and wrong. This is also a bit is an important part, means that Allah Subhanahu wa Taala give us the akal, the power of reasoning, the intellectual, so that we can actually is distinguish distinguish the wrongdoing or right doings is important, because that is a come from what is not only our heart, also come to from the fitrah itself. And then the third things actually is our wahi, which is a revelation or guidance from the God. This is important to understand, because by guidance for the proper way, by religions or whatsoever, means that they can control the fitrah, they can control the akal, so that people can to have a good
Prof, I think you are frozen. Salam everyone. We seem to have some technical issues. I believe that's due to perhaps the Wi-Fi connection in Tasmat, Prof. I think the dips and downs. You may continue from where you were, Prof. No problem.
okay. So I need to share back again, is it?
Yes, you have to share the slides again.
Okay, I just recap a few things just now. We are talking about the foundation um, the ethics, as well as there is a roots from the good behavior with yourself and with the community, as well as in Islam, the ethics mean we have to bound the good behavior just now to the based with the Sharia and humility towards the Allah Subhanahu wa Taala, and need to consider consequences before the action. This is part that we have done. And then we talk about the just now is the obligation of doctors and hospitals toward the patient in and the medical profession is universal codes, which is actually is shared by all, sense of a shared responsibility and ethical commitment. Okay, I actually is I did elaborate just now in terms of how the ethical part actually is come into the place. In Islam, there will be a three level, which is a fitrah, al-akal, and then al-wahi. The fitrah is about the innate nature of human being, good and bad quality. So, for example, if you have the people who are killing other people, so it's I mean across the board, all mankind actually. So we say this is a bad thing, sir. This is actually is wrongdoing. So this is a fitrah, is something which is come from ourselves that happen. Even the animal also, they have the fitrah that saying that we're killing other, actually is a sin, or is a bad thing to happen. The second thing is about the akal, the reasoning, the intellect, distinguish right and wrong. This is a given that Allah Subhanahu wa Taala give us the akal for us to give this a function. So this is something which is different from us with the animal, because animal don't have akal, but there is good things about this reasoning, so that we know by thinking, by the intellectual part, we can actually is know this action is right or this action is wrong. But this is again is across the culture, the place actually is a different. And the third thing is the most important is that the wahi, which is a revelation, and the guidance from Allah Subhanahu wa Taala, from God, how we have to control the fitrah and the akal together. That is the ultimate that in Islam, the guidance from Allah Subhanahu wa Taala is an important part of the ethics. Can you listen to me properly?
Yes, Prof, you are very clear.
Okay, thank you. Because I think this is a three-part, the three pillar of the medical ethics, the Islamic medical ethics is the most important part, so that we can understand actually is why the Islamic medical ethics is different from the Western ethics. Okay. Four part that we are discussing in terms usually when it comes to the medical principle of medical ethics, we are going to have this four. Alhamdulillah that in Islam also this part of the principle actually is can be used to in our this one, and then we have the evidence saying that the most important for us is in terms of autonomy, respect for the patient right to self-determination. We allow the room for the patient to decide what actually is the best for them. The beneficence that the duty to do good, and then this is a part of in fact, you know, the quote of Socrates about doing things. We have to do a good thing to others, and the third thing is a duty to do no bad, means do no harm. Okay, this is another principle that actually is bound us in this the medical ethics. And then the last one, which is I think is justice or fairness and the equitability, and then to treat the patient or to the people equally. Okay, this is a common principle, which actually is we have the agreement between the Western ethics as well as the Islamic ethics. And then this is a lot of major issues in ethics in medicine. We are not going to discuss a very detailed here, but actually it's good if I can mention a few things about the patient's right, the equity of resources, the confidential of the patient, patient safety, conflict of interest, especially in terms of the treating the patient, which is maybe it's our family or whatsoever. The ethic of privatization. This is something which is I think is a become common now when come people go privatize or do the private practice. The informed consent, dealing with the opposite sex, especially for us in the suspect at IOM, we have the rules, regulation, how we should treat or come to the procedure, come to the a lot of communication between different gender for examination, clinical setting, or everything. We have to follow the proper guidelines, and then how we treat the beginning and end of life when the patient born, how the Islam look it into. This is a bit of the ethical issue there, as well as the end of life. When come to the end of life, we know that patient actually is come actually when they are dying. What is the needs of them? How do you going to deal with them? Because in Islam, maybe it's a bit different from other religions. When come to death, death is considered the beginning of another life, something like that. So this is something which is different, but we have to prepare people ethics issue, how we going to deal with the dying people. And then also there is ethics in terms of the medical team, the healthcare team, how we are going to deal with our parties in the team, our superior, the relation or the communication between the doctors and doctors, I mean our colleagues, our doctors and the superior, maybe the medical officer with the consultant or with the houseman, and then the nurses, everything which is inside the team. There are a lot of the ethics which is bound us together. And then in our setup in Malaysia, we are bound to the medical profession governance by law, and especially I think this is important for us to understand also, is about the code of professional conduct. MMC 2019, as well as Medical Act 1971, which the last amendment was 2012, and as well as they will usually read together with the Regulation Act 50. This is if you need to understand, this is the law that actually is govern our profession. If you ask me about the Medical Act, it's medical acts in brief. They are always try to protect the public from the doctors. They are not really protecting give the what is the supposed to be done by doctors, or something like protecting the doctor from any other parties. So the other way around. So that is important that we need to understand, because we are doctors, we are bound to this law. But most of the time, I did a brief study on this Medical Act, medical negligence. It seems that our doctors actually is not really understand what is the Medical Act. I think it's important for us to understand it and then to know that how this law will affect us. Even recently, we have the something which is tabled in the parliament regarding the training of doctors. So this is actually issues for doctors, for us actually is to aware of. It's important for us to know this. There are a few books also that we can actually is go through and then get the information in terms of the governance in the medical practice. We go to the second part of it of a professional in medicine. I think is most of us know that we are doctors and then we are a professional. But what exactly the professional is in terms of from the Merriam-Webster's dictionary, they said the professionalism is a skill, good judgment, and polite behavior which is expected from a person trained to do the job well, like us. And then there is another definition. I think this is from the law definition. The professionalism is commonly understood as the individual adherence to a set of a standard, code of conduct, or the collection of qualities that characterize accepted practice within the particular area of activity. For us, actually, is in the hospital setup, in the clinic setup, or any health institution setup. And another things that the competency as a professional is judged depend on our habitual and judicious use of communication, knowledge, and then the technical skill that we have, clinical reasoning, the emotions, values, and the reflection in the daily practice, which is the ultimate goal is to the benefits the individual as well as community that we are served. This is another competence statements in terms of the doctor's professionalism. And then the most of our doctors as a professional, we place the interest of others ahead of our own interest. This is depend on the known our what is a priority that we have to do at that particular time. Okay, so as the first step to be a professional is to decide whether you are the one. You are professional or not professional based on the whatever definition that we are discussed just now. This is important because I think that is the basis of how you are encountered or how you accept your professionalism. The few elements of professionalism by the settlement. In the profession, we need a formal education. We have to get a body who control over the educational standard. This is actually is self-regulation as well as a self-disciplinary standard. And then also the presence of the scholarly journal or the articles who are actually is make together, as well as we have to up to that standard. Relatively high social status, okay, we can understand. Even we are doctor, we are actually is higher than others. These are the normal people in terms of the social status. We have to understand that. Then protection from the regulation as well as market pressure. For example, because of the demand in the private, is as a professional, we know that what is our stand, why we still in the government, why is we still in the university hospital. So that this is a part of the things that the element pressure will take place. And then there is a four domain that actually is important for us actually to know that we have the most important as a professional. We have to maintain the trust. We have to improve in terms of knowledge, skill, and performance, the safety as well as quality, and the most important, I think, the communication and the teamwork with others. Okay, dimension, this is I take from the Western model, but actually it's a good to mention because actually that maybe we have to add on after that what actually is in terms of the Islamic part, because we are not totally actually is rejecting the Western model, but we have to take the good things so that we can practice it as well. But we have to be guided with the creation, the creator. I mean, that we have to be guided by Tawheedic principle or Sharia for our practice. Okay, there are four major things in this dimension: the accountability, altruism, the excellence, and humanism, and others as well. So this is a part of a professional with the good understanding of ethics, good communication, and then the clinical competence as the basis of this professionalism. Okay, for the Islamic perspective of the basic value of professionalism, we have the list of things that maybe is good for us to discuss a bit in terms of the faith, the taqwa, the consciousness, the best character, the akhlaq, the excellent performance, itqan, al-amal, the strive toward the perfection, responsibility, the amanah that given to us, as well as the accountability. Some of the features here also is overlapping with the whatever we discussed in terms of a Western model just now. And then we discuss a bit of Iman, how Iman or faith improve the professionalism. This is the way that motivating the practice of a holistic medicine. We're going to talk about the holistic medicine, maybe important of the not only we are treating the patients physically, mentally, emotionally, but we also have to think about the spirituality of the patient as well. This is according to the Tawheedic principle or the Sharia guidelines. And then this iman will make the physician more humble and less arrogant. We are in the profession that we are not supposed to be arrogant, and then we are not supposed to be actually inhuman. But the realization of this is an agent and not to cause the cure, because we are as agent of healing. We are not the one who heal the patient. The cure, the ultimate cure is Allah subhanahu wa ta'ala determination. Means that is a decisive decision by Allah subhanahu wa ta'ala. And then Allah subhanahu wa ta'ala is the ultimate healer. And then this is the principle of qadar. It's important that we can understand our role, our position as an agent for the healing, not to the curative. Okay, the second part is about taqwa. What is the taqwa? It's a self-consciousness. Then this taqwa will make doctors or physician conscious of his duty, meticulous in performance, and the knowledge, full knowledge that Allah is watching us and know all the whatever being done. So by knowing, by our conscious that we are always somebody who are looking at us whatever we do, that is important part, so that we can do things honestly, even we know that no other people see what we are doing, what we have to do right from the beginning, and we have to do it properly. And because Allah is always looking at us, there is no any second that we are not under the vision of Allah Subhanahu wa Taala. This is our belief, and this is important concept that we do when we are doing something. The human observers who cannot see hidden mistake and bad intention. We are simply can actually is when do something mistake, we just keep quiet and then keep to work, and then we sweep it under the carpet, everything. Nobody knows, but Allah knows it. So this is an important concept that we have to know. The third things is about the akhlaq, our manners. The akhlaq ensure the best human interaction between doctors to doctors, doctors with the patient, and then also with the superior. And then the manifesting as akhlaq will show in whether we are balanced, or we call it tawazun. We have to be actually a balanced person, humility, brotherhood, as well as the social respectability. There is a features that shows that how the akhlaq actually is can be seen in a different things. So depend on what we are doing. That's why the akhlaq and adab is two important part that important for us to bound us so that we are become a good doctors, and then we are human doctors, or we are whatsoever the best doctors. Okay, this is important not only for ourselves but also for the patient. Then I will list that is the Islamic character of professionalism. There is a lot of other things that maybe I don't mention it directly, but this is also the quality, the sincerity, sincere intention, the need in work, done task fully and then thoroughly, properly, finish the work properly. And then we have to know what is our ability. Kafa'ah is, we always know what is actually is we can do. Some things we need to have the boundaries, or we can need to limit what we can do as a doctors at the best of our knowledge. This is important. So this is a part of the character of a professional. So, and then we have to be a free hand, willing to help others, especially in our team, as well as a responsibility, the working spirit, a good working spirit. Every day we come to work with a good motivation to work, and then also we help our promises. When we make promise, we have to obey it, as this actually is a part of the our obligation to fulfill the promise. Okay, this is a part of the clinical character of a professionalism. And then in term of the professionalism, we can summarize this is the two most important things, what we call a life awareness or sense of a responsibility. And the second thing is actually is we know what is our expertise, inherited character that we have. And then whatever we do, we have to exercise it, or we do it because of Allah Subhanahu wa Taala. I think this is a part of the use of where we come to the professionalism. We have to give this character in ourselves. Okay, I think we go to the third things that we're going to this one, because we already talked about the ethics. We are going to talk about the professionalism. We are also bound to have this what we call the etiquette in the medical practice. Basically, the etiquette is about the adab, how we perform it, how good is it, how it is we do it according to the proper way, the best practice. This is about the etiquette of the medical practice. And then I took it from Prof. Omar, is in terms of physician ethics at Adab al-Tabib. The good doctor etiquette with the patient and families is when we do it at the bedside teaching or bedside visit to the patient, how we interact with the patient, good manners. We put a compassionate for the patient. We ask not only the problem with their physical problem, emotional problem, but also the spiritual needs of the patient. This is a part of our ethics. And then also for the caregiver, the relatives of the patient need have to good relation, especially when the patient is unstable, patient is not fully conscious, or patient is a minor children or whatever, or we have to talk to the caregiver as much as we can talk to the patient, give their room to patient to give feedback, as well as we have to convey the proper message. In the principle, when come to this, we can reveal the truth of the patient, but not all the truth, because we know we are bound to the certain confidentiality of anything that we give to the patient. But as long as a patient can understand what if we are discuss, actually is that is more important. Then we have the ethics interaction with between the genders. We mentioned just now, men with men, when with the female, as much as for the hospital concern. In our hospital, we have a guideline to this. As much as possible, is come to the opening the aura, like the chest, like doing the putting the CBD, do the parental examination or whatsoever, which is actually is doing something a private part, everything. The best actually is we let the same genders. Okay, even the same genders also, we need somebody else actually is to be a third party, because of in our setup in SASMAC, we have the case when patient sues, actually is complain about the doctors, same sex. They do something like a per rectal examination, that maybe they feel like there is something actually is not right with that was it happened during that time. So we make a rule that even male with male patient, as female doctors with a female patient, still they need people, fair people to be around to actually is to convince there is a fair treatment given to the patient. Okay, this is about the gender gender interaction. And then also dealing with a family, we always as a doctor have to get their family conference and then talk to them. This is how we have to do this, ethics on that. Then good doctor ethics in the healthcare team, together with our colleagues, ethics in teaching and learning in healthcare team. We should have this one, because as a professional, we mentioned about the domain just now, improve our knowledge is a must for us. We always need this one. And then most of us here actually is our postgraduate. You are doing the postgraduate. I'm sure that this is it's not difficult for us, because of every day we are having learning, we are session, we have teaching, either formal or not formal. It's just a depend. But still, we have the ethics in terms of this. And then also in terms of a care delivery, how the way that they are taking care or giving the treatment for the patient, they also have a bound to the proper adapt. Okay. For example, the doctor-patient relationship. This is the prime element, or this is the most important part for in the consultation. We should include the respect, the care, the communication between both parties. This is important because most of the patient, they highly ranked physician behavior related to the communication skill. Communication skill is the most important part, which is I need to emphasize again. And then the best thing is the rapport, build trust, build rapport with the patient is major things. So that actually is we can reveal what is actually the patient problem, and then we can actually give the offer of solution of the treatment for the patient. So the exchange of view, you have to ask what does the patient think as well when treating the patient. Clinical decision making, we know that our profession is to heal, even we are the agent of healing. So we consider it as a good healing action for the patient. So There is a difference between right healing action as well as good healing action. What we are aim is actually is a good healing action. We are not only using the scientific and clinical evidence to get to come to the diagnosis, therapeutic, or actually is other things in the supporting the patient, but we are looking at the patient value and preference. This is actually is key factors whenever we do the clinical judgment for the patient. Okay, then the clinical judgment is a depend on what is either it's a diagnostic question that we give, or therapeutic question, or prudential question. To actually is openly or welcome the patient preference as well as patient value. Though, so I'm also like to talk about the patient-centered care, which is I think is important concept that we need to understand that um, we have to go away from the traditional patternistic model, which is actually is doctor are very dominant and doctor decide everything. Okay, so we need a patient active involvement as well as the continuity of their care. And this is the key signal trustworthiness and then a crucial aspect of the patient-doctor's relationship. And then in the studies shows there is a lot of a positive outcome, and then most important, increase the patient satisfaction. This is actually is a part of our aim to serve the community and the patient as well. Okay, I will touch a bit of this effective communication, because most of the problem with the doctors is because of the break or the miscommunication, that we don't actually allow for the proper connection between we and the patient and the surrounding, even from the doctor to the doctor. This is a effective communication, which is we need to have shared information properly, the truth, common shared understanding, which is developing during the consultation, which help to develop trust and then build a good rapport with the patient. And again, we have mentioned about how we should have the good doctor-patient communication. Okay, there's from the chart that I give here, there is things that how we are going to properly put the effective communication in our professional. Okay, I will talk a bit on these few issues in terms of the professionalism as well, the privacy, confidential, and considered. As much as possible, we need to keep the privacies of the patient and the confidentiality. We are not allowed to open and publicly talk about the patient, whatever we discuss about the patient. Confidentiality is important to actually is ensure the confidence of patient towards the doctor and the hospital. And I'm not going to talk very detailed about the consent and then the reversal of a treatment, but certain people, there's certain group of patient, they have certain needs, how we are going to take the consent, and then what is the right of the patient to refuse of the treatment, which is I'm not going to pass detail about this part. Okay. Okay. I think it's for the professional. We mentioned about the act, we mentioned about the law just now. We have to mention about the medical error and medical negligence, which is important for us to understand, because we are bound to the law, so that we are also bound to be, you know, patient complaint and litigation, as well as a suit because of any doctor's misconduct or negligence that happened. This is important for us. I think is we need another session if you are going to talk about the medical negligence or what it can happen. What is the parameters, or what is the steps, strategies that we have to do in day-to-day practice, so to make sure that we are actually is buffer or away from this medical negligence, which is, I think, in this new era, in this coming years, the medical negligence, the doctors be sued actually will come out more and more. And then the awareness of the patient in terms of this one also is giving the major factors to decide whether they are sued the doctors, and then a lot of things that can happen in the medical world and medical fraternity. And there's a few things that I need to mention in terms of the abuse of professional privilege, because we are doctors, we have a lot of privilege, especially in the society, or anything, even for the buying car, good discount for the doctors. Why? Because of this, they say professional, but they know already doctor have the stable income, so that they can actually get things done properly. And then we need to know also the private misconduct, derogatory, as well as reputation of a doctors. Uh, we are not only talking about the personal reputation, but we also talking about the reputation of a profession, as well as at the hospital or any medical center where we are. So this is in term is important that we need to understand this. And then we have also issues of public professional misconduct, in which something like people advertise the service, which is not allowed for the doctor to advertise their service, or mm, tremendously actually is putting in the Facebook, in the social media, in terms of their expertise, everything, which is actually is something which is not right here, because we are bound to the professional. We cannot actually is directly advertise our expertise, unless this actually is maybe is done according to the proper way, or proper rules and regulation. Medical malpractice and negligence, this is something which is I think need to have the proper input, especially for us, our awareness in terms of the malpractice, and then the negligence. Um, we have to know what is our liability. Doctors have the huge liability, because they are open, or doctors has good and then or usually have the interaction within the patient, the clients, everything. So we actually is liable to be sued, and then to have the a complaint regarding whatever we do. Something like the malpractice suit, the court procedure, litigation. If anybody have experience in this litigation process, I think this is a great tremendous, and that will disturb our life, our careers, everything, and then even sometimes they are actually we affect our pocket. Maybe we have to pay the huge numbers, huge amount of money to settle this what you call the suit, or litigation by patient. Okay, the most important for us actually is to avoid or prevent the malpractice suit, so that we have to do a lot of things to make sure that our profession go nicely, properly, and then according to the good conduct. Okay, I will talk a bit of this one. This is the last part of my slide: declination of ethics, professionalism, and the consequences, and then few tips what we should do as a Muslim. Okay, the professional, what we do is this is a few things that we recap again. It's important for us to understand the outcome based on professionalism and ethics. We have to consider what is our decision, the clinical decision making, our relationship with the patient, the quality of care, the patient-centered care, as well as the good communication. And then we should, remember, you see the chart that we said that what is the purpose is either it's evidence-based, outcome-based, or the principle-based. And then round with the core knowledge, the core behavior, and our knowledge as a specialist or going to be a specialist very soon. This is actually is that we can understand the whole purpose of be a professional. Few challenges why the decline of professionalism occurs because of interpersonal skill, lack of interpersonal skill, and then we are having highly distress in terms of the during training. And then we cannot forget about the maybe it's a personal traits. Our actually is what he inherited to in ourselves, our character itself. Maybe this is actually it need to be a bit of a transformative changing our personality so that we can suit the needs. Lack of communication, then the second thing is a large geographic variation of healthcare because of the urban and cities, urban and suburban part actually is a different communication going to be different. The social status of a patient also are going to be different. The ethical value and the court suite that actually is we are elaborate just now. The time constraint on healthcare provider. This is actually is truly happen now. We have lack of doctors, not lack of doctor, the reduced number of doctors, of even the when a medical career doesn't feel like the attractive anymore. So this is actually a challenge for our profession as well. People tendency, youngsters, young doctors quit the profession and went to the private sectors, or they went to work somewhere else, or even some of them actually quit just to become the influencer and then be do business or something. And then also of a lot of a conflict of interest. We are talking about the conflict of interest as a doctors to the patient, as well as a doctors to the hospital, and then hospital itself. They have to understand that they have to actually away from the conflict of interest. So few things that I think is important for us to improve our core value. How do we have to act properly in a proper manner to get the good professionalism? How you're going to dedicate this professionalism? Get things done in timely and thorough manner. Do it properly. Finish it. Don't actually is left with our task to somebody else, that you have to complete it. Be disciplined and focus what we are doing. Prepare yourself before you come to work, and then they will actually is reduce the time for you to do that, as well as actually is you are more high chance to get the success in terms of whatever you are doing. Be honest, polite, and fair to others. Maintain the positive attitude and demeanor. Be flexible, be creative for most of the time, because we actually don't be too rigid, because too rigid means we are actually is try to put people away from you and display their passion, be passionate, and shows our responsibility towards others. In summary, the physician should professional and have a good working ethics. I think this is actually very clear for us. Take the work as a trust, amana for us, involving the sincerity of intention. Every day we come to work, we have to correct back what is our intention. The intention is not only for just forget the salary at the end of the month, but also to get the mardatillah, which is the bless or rather from Allah Subhanahu wa Taala. Okay, then the good quality work. This is must be our aim. Itqan and ihsan that we have discussed just now. Then accept accountability. Accountability. We always need to improve ourselves. We need to actually reflect ourselves, and then as much as possible, what we can do is ready to make a correction. Then need to actually is change ourselves, or we have to transform our attitude toward the better one. Okay. So the last word from me, our aims, tagline of our suspect, go toward helping hand with a loving heart, a compassionate heart, and avoid medicine without soul. Okay, with that, I will thank the organizing committee to invite me to give me a chance to share what was my thought in terms of Islamic perspective of the medical profession as well as ethic, plus the etiquette, what we should do. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh, and a very good session by Prof. Amin. We also want to apologize from our side on some of the technical issues. Maybe Tasmac, we can upgrade our Wi-Fi connection, Prof. We have
Yes, I
about
think so.
5 minutes left. Maybe we have one question from the floor. Anybody would like to ask anything to Prof. Amin regarding ethics or anything like that related to your current status?
Assalamualaikum, Prof. Amin. And
Waalaikumsalam.
Waalaikumsalam.
Thank you, Prof, for joining this session. Even though you have a very tight schedule this week, I'm very happy that you joined this session to be our speaker. I have one question. I would like to echo back one question being posed by Dr. Iqbal yesterday, because I think that the answer can be explained further. I make it the question to be general. Let's say that we face a situation whereby we receive a request from a patient, which is quite different from our ethical belief and background. So the patient requests something that is against or is really not equal to our ethical belief and background. So either we should deny the request or the service, or should we transfer or channel to the other center, which is actually not in line with our belief. So which one would be the better option, Prof? Thank you. Prof. Amin?
Prof is a bit frozen. Okay, I think we lost him. Is he back, Prof? Did you get the rest of the question just now?
You get the question, Prof?
Prof,
Amin, unmute yourself.
Prof,
Okay,
did you get the question just now?
Recap the question. The question is what we should do when we have the different, whenever the patient actually is request something which is against what is our belief on our ethics. Is it right, Saiful?
Yes, Prof.
That's right, Prof.
This is always a common problem, but it's a realistic, because commonly we have seeing the patient. The approach of this is depend on the condition. We have to tackle it individually, not as a whole. In general, what actually is we should do is we have to at least listen to the patient. Sometimes by listening properly, but we actually can say what can I say? We can listen to it, but we don't actually not agree with that. So in other words, do we have a technique that we can impose for the patient? We listen, but we have to respond to that, not directly actually is against whatever the patient said. Because as a doctors, as we know that the patient also have a right. Patient have an opinion. We are in Islam, we encourage that the patient also give their opinion on whatever issues. But this is come to this situation where we have the different concept or different thought or different opinion, and it's against our ethics. So we have to actually is a very careful. Although we are listen to them, that we have to politely say that this is something against our professionalism. I think not only doctors, other professionals also, they will do the same. Most of the time, for us, we not actually is against what the patient words, but we actually is respecting what their opinion, but at the same time, we have to stand in terms of our ethics. We can't really do such things, so that they have to don't argue with them, but we have to make them understand that we also have to be stand, and then actually it's bound to our ethics that we have. I can't think of any example here, Saiful, but I think that is supposed to be done. Try to actually solve the problem without argument, but also by listening, as well as actually try to make them understand what is our role here, what is our ethics, what is the things about doctors from do certain things that maybe is not desired by them.
So taking the middle ground and avoiding conflict, so make patient will understand our beliefs, so that they
Yes.
respect us. In turn,
Yes,
we also
I just
yeah.
came back from the certified mediation course, but I think that is the taking the middle things actually is the best part, uh, and then use the common ground to actually develop from, see whether this is not things that they are right, but looking at their needs and their interests is
So we still
important.
maintain respect for patients, as well as patients maintaining respect to us.
Yes, we have to maintain the respect of the patient. Yeah,
Thank
agree.
you, Prof. Amin, for that session. We will jump straight right through. With this, we have Prof. Amin, Prof. Ibrahim, as well as Dr. Nazmul, who will also be joining us on the panel sessions. For the group presentations, I invite Group 7 to start their presentation first. Again, I remind the groups that you guys have 20 minutes. You will be given a reminder verbally or through the chat 5 minutes before your session ends, and you will have about 10 minutes with the panels. The theme today is application of Fiqh, Al-Ibaadah, ethics and professionalism's application in critical issues. Without wasting any time, I would like to invite Group 7. Thank you.
Hello, good morning. Hi, am I audible?
morning.
Yeah. Hi, my name is Dr. Surain. I'm from ENT department. I'll be presenting my group's topic in a while. Okay, let me just share my slides. All right, can you all see my slides, please?
Yes, can.
All right, okay. Okay, good morning again to respected professors, panel experts, and my dear colleagues. My name is Surain, so I'll be talking about Ruksha in solar. And the topic that's given to my group is actually to explain about Ruksha, the benefits and so the examples. And we have two case scenarios that will be taken, that will be presented over by my colleagues later. Okay, all right. So our supervisor is Dr. Haidar. Okay, these are my members. Okay, all right. Okay, introduction. In Islamic jurisprudence, a ruksha refers to a dispensation or concession granted under certain circumstances that allows a person to be excused from performing a certain act or to perform it in a lighter or easier manner. In the context of salah, Islamic prayers, ruksha can apply to situations where a person is allowed to perform their prayers in a manner that deviates from the usual requirements due to specific reasons such as illness, travel, or other valid excuses. For example, during travel, a person may be allowed to shorten their prayers or combine them to make it easier while on the journey. These concessions are provided to make it easier for individuals to fulfill their religious obligations in challenging situations. All right, the benefits of ruksha in salah. First of all, ease and convenience. Ruksha allows individuals to fulfill their religious obligations in a manner that is more convenient and manageable under certain circumstances. For example, shortening prayers during travel can make it easier for those who are on the road. Okay. Next, accommodation for special circumstances. It accommodates individuals who are facing challenges such as illness, travel, or other valid excuses, allowing them to perform their prayers without undue hardship. Next, we have preservation of health. those who are not well, like Ruksha allows them to modify their prayers in case of sickness or physical limitations. Flexibility. Ruksha adds flexibility to Islamic worship practices, recognizing that there are times where strict adherence to all the rules of prayers may not be practicable or feasible. Next is maintaining connection with Allah. By providing concessions in prayers, individuals can maintain their connection with Allah and continue their spiritual practices even during challenging times. And reducing burden. Ruksha reduces the burden on individuals, ensuring that they are not unduly stressed or overwhelmed by their religious duties. Overall, Ruksha in Salah serves to facilitate the practice of Islam in a way that is both spiritually fulfilling and adaptable to the various circumstances that individuals may face in their daily lives. So example of Ruksha, we have tayammum, shortening of combining prayers, sitting during prayers, gesture instead of speech, excuses for delay. We'll look at number 1 first. Okay. Tayammum or dry ablution. It's a substitute for wudu, using clean earth or dust when water is not available or its use is harmful. It's permitted in cases of illness, lack of access to clean water, or other valid reasons. Intention, niyyah. Formulate the intention to perform tayammum for prayers. Strike the earth. Strike your palms lightly on clean earth or dust. Wipe your face with both your palms. Wipe hands. Wipe each hand up to the wrist, ensuring to wipe between the fingers. Intention for prayers. Make the intention for the prayer you are about to perform. Shortening prayers during travel. Travelers are allowed to shorten the 4-unit rakah prayers, Dur, As, and Isha, to 2 units, and also combine Dur and As prayers during the time of either one. This is to ease the burden of frequent prayers while traveling. Okay. Sitting instead of standing. If sitting is not possible due to illness or weakness, a person can pray while sitting. The prayer positions are adapted accordingly. Modify the prayers positions accordingly. Sitting position, if possible, for recitation of Quranic verses and supplications. Performing the bowing, ruku, and prostration, sujud, as much as you are able to do so. Gesture instead of speech. If someone is unable to speak audibly, they may gesture instead of reciting parts of the prayers aloud. Excuses for delay. If someone misses a prayer time due to valid reason, like forgetfulness or sleep, they can make it up later without penalty. If you miss a prayer, as I mentioned earlier, you can make it up as soon as possible when the reason ceases. Okay, now we'll be sharing some case scenarios. I'll pass on to my colleagues.
Hello, good morning, everybody. I'm Fan here. I'm Fan here from ONG department. So thank you, Dr. Surin. I will continue with the with my case scenario. So can I have the next slide, please? Thank you. Okay, so so the case here is our patient is currently on a stoma bag in which the feces and its contents are always present in the stoma bag. He asks you how he can perform solar. How about if the feces came out during solar? So next please. Thank you. Okay, so a colostomy is a surgical procedure where the bag, where the large bowel is diverted to skin opening on the abdomen, directly fecal matter into a bag. So this situation actually raised significant concern for the patient regarding their ritual purity and the validity of their prayers known as solat. Next please, thank you. So there are actually 2 common issues that arise with patient having a stoma bags. The first one was actually maintaining the validity of the ablution and managing the perceived impurity due to fecal content in the bag. So this issue can be challenging for the patient to feel confident in their religious observance. Therefore, can I have the next slide, please? Yeah. So therefore, Malaysia has published fatwas on this matter with supporting Dalil and Hadith. So these patients are in a state of disability, or we call that darurat. So therefore, as long as the fecal matter is contained within the constraints of the stoma bag with no spillage, he is not considered impure and may not need to empty the contents of the bag each time prior to performing ablution, as it also served as an inconvenience to the patient, requiring multiple stoma bags as multiple trips to the bathroom. Yes. So ablution should be performed as soon as the prayer time is confirmed, and the patient should avoid delaying time between ablution and performing of solat. And the ablution and prayer is considered valid even if in the middle of the prayer there is a fecal matter excreted in the stoma bag. So the ablution is also valid for any other acts of ibadah which are intended to be performed within that time. However, ablution should be repeated once the time comes for the next fard prayer. This is because ablution is only taken to perform prayer, not to raise hada. The patient position is same as that of a patient who is always with hada. So this is actually this teaching is supported by Sulaiman Al-Jama, who note that the need to repeat ablution for each prayer is because ablution is intended for the act of prayer itself, not for removing a state of continuous impurity. So if the patient wish to perform jamak or combine of 2 consecutive prayer time, he may do so. However, the patient must perform ablution twice, once prior to the earlier fard prayer, once prior starting the second fard prayer. Next, please. Okay. So ablution expires when any substance is excreted from the urethra, we call kubu or anus tubu. Patients who have stoma bags have fecal matters being excreted from neither passage, hence their ablution is valid. So from Imam Shafi opinions, it stated that the substance like vomit, nosebleed, or blood not existing through the pathway of hadat do not invalidate ablution. So this principle also applies in our case scenario, a patient with a stoma bag as well. Next slide, please. Thank you. All right. So from Iman Mawadi, it clarified that the substance excreted from a non-hadas pathway, whether pure like tears or impure like vomit, do not invalidate ablution as well. Same as a patient with a stoma bag. Okay, and the next slide, please. Thank you. So the allowance for solat in states of daima hadas is as per this hadith. So the hadith narrated by Aisha recounts an instance where the Prophet Muhammad advised a woman with constant bleeding to continue praying despite her condition. These support the allowance for patients in similar states of continuous impurity to perform solat. Yeah. So yeah. Okay, so I've done with my first case scenario, and I pass on to my next colleague to present the next case scenario. Thank you.
Is the speaker on? If we have issues, any of you may just continue on with the meeting, with the presentation.
Okay, I'll just continue. Okay. your colleagues ask you either you are allowed to Jama, Solat Zuhur or Asar before enter operation theatre, as the coming surgical cases that you're going to conduct is expected to end at night beyond Asar. Permissibility of Jama combined Solat. In Islamic jurisprudence, there are certain situations where it is permissible to perform the Zuhr and Asr prayers together, Jama, or the Maghrib and Isha prayers together. This is known as Jama combined Salat. The main conditions for performing Jama Salat are travel, when a person is traveling and it's difficult to perform the prayers at their respective times; rain or extreme weather, where there is heavy rain, snow, or other extreme conditions that make it difficult to perform the prayers at their respective times; medical necessity, when a person is in situation where performing the prayers at their respective times would cause undue hardship, such as in the case of medical emergency or surgery. Applying Jama Solat in the surgical case. In the given scenario, the upcoming surgical case is expected to end late in evening beyond the Asar prayers time. This would fall under the category of medical necessity, as performing the Zohor and Asar prayers at their respective times would cause undue hardship and disruption to the surgical procedure. Therefore, it is permissible to perform the combined Jama Solat of Zohor and Asar before entering the operation theatre, as long as the following conditions are met. That is, the intention, Niyyah, is made to perform the Zohor and Asar prayers together. The combined prayers is performed within the time frame of either the Zohor or Asar prayers, and the combined prayers is performed in the correct order, with the Zohor prayer first, followed by the Asar prayers. The opinion of contemporary scholars, okay, Sheikh Dr. Yusuf Al-Karatwi in Fatawa Al-Mu'ashir, when asked about the ruling of Jama for surgeons performing hours-long surgery, states that he can Jama the Zuhur and Asar prayers, Maghrib and Isha prayers, whether Taqdim or Takhir, according to what is easier for him. These prayers are performed in Jama without Asar, according to the Mazhab Imam Ahmad, that permits Jama due to sickness, referring to the hadith of Ibn Abbas in Al-Sahih. Okay, Sheikh Atiyah Sar, Chief Lajna Fatwa Al-Azhar, in his fatwa explained the opinion in Mazhab Hanafi, saying, it is permissible for a patient to Jama his prayers if it is difficult for him to pray at the specific times. The same goes for a mother that is nursing a child while she has experienced bleeding, istiadah, to avoid the difficulty of purifying herself for every prayer time. It is also applicable to people experiencing incontinence. It is also permissible to Jama the prayers for people that are unable to determine the beginning of prayers time, such as those who live underneath the surface of earth, such as minors, people that fear harm to his life, property, or dignity, or harm to his living if he does not perform Jama. Furthermore, it is also facilitation to those that would be impossible for them to leave their work to perform prayers at a specified time. Lajna Daima Lial Buhut Wal Al-Iftar Arab Saudi, in fatwa numbered as above, states that doctors that are in charge of surgery should pray at a specific time for prayers. However, it is permissible in desperate situations to perform Jama, Taqdim, or Takhir, such as Zuhur, Asar, and Maghrib and Isha, when there are desperate situations as for prayers that cannot be performed in Jama. Asar and Maghrib and Subuh, Zuhur, if possible, they must be performed at specified times, even if he has to replace with another doctor or staff in rotation, that is the best. However, it is not possible, then it's permissible to perform the prayers late or replace the prayer, Qadha, after the surgery is over. This is due to the fact that there is a facilitation in desperate situations. The Sheikh Fahid bin Abdullah Al-Hazami, it is permissible for a sick person to perform Jama for his prayers if he's about to be operated on, and will impossible for him to perform his prayers at a specified time. Thus, whoever that undergoes a surgery that starts at Zuhur and ends after Maghrib or before the Maghrib, he'll be in pain recovering from the surgery and cannot perform his prayers. Then it's permissible to Jama. Okay, the same is applicable for those doctors that's performing the surgery. Sheikh Walid bin Rashid Saidan, in his book, says that it's permissible for a surgeon to perform Jama for his prayers if he's unable to pray at a specified time due to his job nature. Conclusion, therefore, in this case, if the surgical case is expected to extend beyond the time for Asar prayers, you and your colleagues may choose to perform Zuhur and Asar prayers together before entering the operation theatre, ensuring prayers are fulfilled in a manner that respects both your professional and religious obligations. how would you
We have
advise?
about a minute, yeah?
Okay,
So
how
I
would
would
you
suggest
advise
that
your
we wrap
Muslim
up.
patients who sustained lower limb fractures to perform solar and while on distal femoral traction? For Muslim prayers, for Muslim patients who are sustained the lower limb fractures, okay, here are some of the guidelines that we can use. Adaptations based on condition, lying down if the patient is unable to stand or sit. They can perform their prayers while lying down. They can use their head, eye movement to stimulate the actions of ruku and sujud. Sitting, if they can't sit up with the help of pillows or bed adjustments, they can perform their prayers in a seated position. Modifications of prayers, of movement, sorry. Takbir, starting their prayers. The patient can say the takbir while in their current position, lying or sitting. Ruku, bowing, instead of bending down at the waist, the patient can nod their head slightly forward to indicate the bowing. Sujud, they can lower their head down further down, either on a pillow or by imagining their movement to simulate the prostration. Sitting between sujud, if lying down, they can just pause briefly before simulating the second sujud. Recitation, they should continue to recite the necessary verses and supplications in their heart or softly aloud as their ability. Use of props, pillows, or adjustable can be used to support their patients. Consulting religious authorities, the patient can be consulted by local imams or knowledgeable persons to guide them for prayers. Maintaining intentions, niyat, to emphasize the importance of prayers behind the prayer, the intentions of the prayers for the patients. Okay. Okay, I think we are done.
Thank you very much. Thank you very much for that presentation just now, Group 7. I would like to throw it back to the panels. Prof. Amin, Prof. Ibrahim, anybody who would like to give any comments? Dr. Nazmus? We have about 10 minutes, perhaps one or two.
Okay, Assalamu alaikum. Very good morning to all of you. Yeah, there's good presentations. Just a little remark. The word ruksha is not the word ruksha. It is an Arabic word. It is ruksa. Ra, ha, swata. Yeah, the way you were pronouncing, it was wrong and it was meaning towards something else. Ruksha, ruksa, swad. This is first remark. And the second is the concept of ruksa is based on the Arabic. The Quran says, yasiru wala tu'asiru, like make it easy, not make it tough. Or bashiru wala tunafiru, like you people should give the good news, not people to be afraid of. And based on that, the legal maxims based on in Islam that hardship begets facility. So in Islam, whenever we are having any hardships, the first things Islam comes up with is a solution. So Islam does not accept any hardships, and so for that's why the maslaha mursala, the public interest, it says always it is accommodated in Islamic theory. So far, yeah, that's my little comment. Please correct it, the word ruksha to ruksa. Ra, ha, swata. Yeah, thank you.
Thank you, Dr. Nazmus. The other panelists or anybody else would like to give any comments or any inputs? Prof. Amin?
Bismillahirrahmanirrahim. Thank you for enlightening us with the concept of ruqsah in Salah, which is, I think, is a very important, especially in the medical field, in the hospital, and this one even for the doctors as well. That's the reason why the principle of that the Islam give us the flexibility in once come to the practice of the something obligatory, which is wajib for us, mandatory for us, fardu for us to do. Important that we know that we have to understand this is something that like salah, prayer, we can't skip it, but we give Islam give the solution that we can actually is adjust it according to the condition that we have. That is the main principle that I think is need to be emphasized to all of us, that something far like salah need to be done however difficult it is. That's why Islam come with a beautiful solution, the flexibility, and then you can modify it, you can shorten it, and then you can pray the salah during that time to another time. Even that we talked about the stomach care just now, which is I think is you know we can understand in when come to the salah we need a purification. We need to actually is clean it properly, but somehow in the certain condition like in the stomach care, when the physical material actually is come out most of the time, you need to have certain things that you can modify it. You can still can pray, but you have to empty it and then take the wudu as usual and pray straight away. Don't wait. And then there must be a in I mean during the particular time. So this is what actually is I need to emphasize that the fardu or the wajib or something obligation for us to do, we have to do as the the people, the Muslim people, but according to the condition, darurah, and then we can have the rukhsah ataupun we call it something which is we can modify according to the condition. This is, I think, is the most important for us is to understand the concept of this have to be done. Whatever it is we have to done, we cannot actually is just not pray because we say we are sick, we cannot pray. That is wrong. Even for us, we have to make the patient understand this. Some patient maybe they want to say, "Oh, I'm sick, I cannot pray, so I actually is do it at the time when I'm ill." How we can sure that our patient, our life actually is we can actually is still breathing tomorrow? We can't really say that. That's the reason why we need to do all these things according to what's supposed to be, but in the proper manner. This is the beauty that I think is a concept that I need to everybody to understand it. Thank you. Right. Allah Alam.
Thank you very, very much, Group 7, and also stepping in the last minute. So that's why I think it's good for the group members to know everybody's part. Yeah, sometimes other technical issues, you guys can step in at any time. And please take note of the corrections that you need to make before submitting it into the Google Drive, especially on the spellings and all these things. In Arabic, it's very, very interesting because sometimes a simple spelling or simple language may mean something completely opposite. Yeah? I think that's what Dr. Nazmus was trying to point out. So thank you, Group 7. We move along straight away to Group 8 for your presentation.
Good morning. My name is Vinod. I'll be presenting for Group 8. Before we begin, I'd just like to share my screen. Can everybody hear me and see me well?
Yes, we can, Vinod.
Can my screen be seen?
Yes, but if you would like to convert it to a full screen. Okay, perfect.
Okay, sure. All right. Hi, good morning, everyone. My name is Vinod. I'll be presenting on behalf of Group 8. Also, a very good morning to the expert panels and also my fellow colleagues. Me and Nalini will be presenting on Fiqh Al-Ibaadah. Fiqh Al-Ibaadah, which is a branch of Islamic jurisprudence that deals with rules and regulations governing the acts of worship, also known as Ibadah. In today's discussion, we will be focused on Saum or fasting and its applications, ethics, and professionalism in clinical issues. So just as a brief introduction, fasting in general is taking periodic breaks from eating. So based on physiology, there are 3 types of fasting: time-restricted feeding, intermittent fasting, and also fasting mimicking diets. So throughout the known time, there have been 2 major dietary strategies that have been extensively researched, which are calorie restriction and as well as fasting. So both these dietary strategies have beneficial effects on prolonging and improving our lifespan by delaying the onset and slowing the progression of various diseases. The effects of, for instance, calorie restriction has been shown to find that increasing health span have been studied in animals, and this has been mirrored in, and these key findings has been mirrored in human studies as well. Calorie restriction has profound effects on a series of diseases such as Alzheimer's, Parkinson's, as well as other forms of diseases. So coming to fasting in Islam, fasting known as Saum in Arabic, fasting is usually done in the month of Ramadan and is a key religious duty for Muslims, emphasizing abstention from food, drink, and also marital relations from dawn to sunset, which is Fajr and Maghrib. It signifies abstention and aims at spiritual purification and as well as self-discipline. In Islam, fasting is a form of religious devotion that promotes spiritual discipline and self-control. It helps Muslims combat materialism and the temptation of the flesh, thus purifying the soul and deepening consciousness of God. The Quran links fasting to God consciousness, stating that it is prescribed to help believers become more mindful of God. So what are the benefits of fasting in Ramadan? So it teaches moderation and self-restraint, which are essential for moral and spiritual training. Unlike some other religious traditions, Islamic fasting does not demand complete renunciation, but rather a temporary abstention, highlighting that natural human urges are not inherently ignorable, but should be controlled within limits. It also calls for refraining from negative behaviors like falsehood and foul speech. The social aspect of Ramadan involves increased religious piety, communal prayers, the Taraweeh, heightened charity, Sadaqah. The month is marked by a heightened sense of devotion and community. So it fosters social responsibility by making individuals empathize with the poor and hunger, promotes self-discipline, reinforcing individual morality and responsibility. So we'd like to talk about fasting in certain chronic illnesses, for example, in diabetic patients, as fasting poses risks in these patients. So, for example, fasting during Ramadan for people with diabetes carries considering challenges. There are risks associated with fasting in people with diabetes, as the normal diet has changed considerably and physical activity levels fall during the daytime compared with other times of the year. These changes can result in metabolic disturbances and also lead to alterations in the timing and doses of diabetic medications. The main risks reported with fasting are hypoglycemia and hyperglycemia. In the summer, fasting periods can last a very long time, between 15 to 18 hours per day, and are often undertaken in hot and humid conditions, which can lead to complications such as dehydration. So as I mentioned earlier, there are some key risk factors associated with patients with diabetes, such as hypoglycemia and hyperglycemia, or they can form a condition called diabetic ketoacidosis, which is a severe complication of uncontrolled blood sugar. It can also lead to dehydration and the formation of blood clots. So how can people with diabetes or any other chronic illness for that matter prepare for fasting? So what these people should do are they should have a pre-Ramadan assessment. So this should start from anywhere between 6 to 8 weeks before the start of Ramadan, which encompasses a detailed medical history and risk assessment. So this is to ensure that the patients are safe to fast, that their medications are modified and adjusted accordingly, and they are given proper education and nutrition advice. So during Ramadan, patients should monitor their blood glucose more than often. So healthcare professionals should provide a structured education for patients, which includes the risk quantification and exemptions and removing misconceptions about fasting itself. So there should be more frequent blood glucose monitoring, fluid and dietary advice, physical activity and exercise advice, medication adjustment and test fasting, and they should know when to break fast and the recognition of hypo and hyperglycemia symptoms. So based on the International Diabetic Federation, they came up with a risk stratification to help identify patients with diabetes in Muslim practitioners, whether it is safe to fast during the month of Ramadan, and this can be categorized into low risk, moderate risk, and high risk. As you can see in this table, it has a detailed history of the patient, and each point is given marks, and these are cumulated, and the scores are adjusted to the low, moderate, and high risk. So for the high-risk category of patient, these individuals are at high risk of developing complications when fasting during Ramadan, and it is recommended that these individuals do not fast. If they still do insist on fasting, it is possible that the utmost care and monitoring should be provided alongside the strategies and recommendations mentioned in guidelines. So moderate risk levels are advised. These patients are also advised not to fast, but many of these patients will choose to fast anyway. So the important personal decision should be made after consideration of the associated risk in consultation with healthcare professionals. They also need to be aware of the techniques or strategies to decrease this risk. And the last but not least is the low risk level. They should be able to fast, and these individuals are at lower risk in terms of complications during the fasting period. So this is basically the categories in a table form. So you've got a low risk, which is 0 to 3 points, a moderate risk, 3.5 to 6 points, and a high risk, which is more than 6 points. So indications to break fasting. The provisions of these rukhsah are mentioned explicitly in the Quran and Sunnah for special populations such as the elderly, lactating, and pregnant women. Those who are given leeway of not performing the obligatory fasting will need to replace the number of days they missed during the month of Ramadan by fasting on other days outside the holy month of feeding the poor. Medical professionals are often consulted to determine whether a patient is to be considered for the provision of rukhsah in fasting during the month of Ramadan. So coming back to diabetic patients and when they are allowed to break fast, they should know the signs and symptoms of hypo and hyperglycemia. So all patients should break fast if their blood glucose is less than 3.9 millimoles or more than 16.6 millimoles. So symptoms of hypoglycemia, hyperglycemia, dehydration, or acute illness occur, and these are the symptoms as per hypoglycemia and hyperglycemia. So there is also something called qada fasting, which is carried out by a Muslim who has not fasted during Ramadan because of uzur. Uzur in itself refers to valid excuses or reasons that exempts a person from performing religious obligations. For example, it can be illness, being on a long trip, pregnant or lactating women, menstruating or postpartum women, people who have lost their sanity, elderly parents who are already physically weak, and these are people who may not observe the Ramadan fasting. Qada fasting is obligatory as it is seen in the verse in the Quran, the Surah Al-Baqarah, where it is said that Muslims should fast, and if you are unable to fast due to sickness or any other reasons, you need to replace them as many days as you did not fast on other days. And if you are still unable to to do qada, you have to pay fidyah to feed a poor man, which I will explain shortly. So a Muslim must observe the qada fast as many days as he or she has left on other days. The Ramadan fasting depths can be done from Shawwal to Shaban. This means for 11 months after or other than Ramadan. If there are no obstacles, Muslims should pay immediately and not procrastinate. Qada fasting can be done on any day, including a Friday. However, there are days that they are forbidden to fast, such as Eid al-Fitri, Eid al-Adha, and the days of Tashriq on 11th to 13th Zulhijjah. So the category for people with qada, for qada fasting or pay for fidyah. So there's category 1, which is obligatory for qada fasting only. People with no obstacles to qada fasting are, for example, pregnant women who left fasting for their health, acute illnesses during Ramadan, or women with menses. This category of people are obligatory to qada fasting, same as the day they left before next Ramadan month. So category 2, obligatory to pay for fine, fidyah only. So people that have obstacles to qada fasting, such as chronic illnesses, patients that are unable to fast, older people, people that passed away without having the time to do qada fasting. So this category of people that were not obligatory to qada fasting, but need to pay for a fidyah. So the amount of fidyah paid must be adjusted to the number of days he or she is not fasting. Where a day, the magnitude is equivalent to 1 moon of rice based on each state. In the current days in Malaysia, that is equivalent to about 4 ringgit. So they need to pay in value of money in the same year before next Ramadan. So obligatory to qada fasting and pay for fidyah. Muslims who are able to fast but did not qada fasting until the next Ramadan also include pregnant women who left fast because they worry about their fetus's well-being. So this category of people need to do both qada and fidyah. We'll be moving on to the case scenario, and I'll be passing it over to my colleague, Nalini.
Good morning, everyone. Our group were given 2 scenarios. I'll be presenting about the case scenario. Our first patient is a primigravida at 24 weeks period of gestation with diabetes complicating pregnancy. She wants to know if she should fast. Her HbA1c at booking was 9.9, 9.8%. So in this case, fasting is not recommended for a pregnant woman with diabetes and an HbA1c of 9.8% due to the risk to the mother and also to the fetus. So an HbA1c of 9.8% indicates poor blood glucose control. Fasting might exacerbate blood glucose fluctuations, potentially leading to hypoglycemia or hyperglycemia. Pregnant women, especially those with diabetes, need regular meals to maintain stable blood glucose levels and meet their increased nutritional needs. So in addition, inconsistent blood glucose levels can lead to complications such as fetal macrosomia, preterm birth, and other congenital anomalies. So this evidence by the guideline, Rukhsah is one of the important rules in Islamic jurisprudence Fiqh that closely connected to medical practice. It can be defined as a concept or rules on the exception to the original rule, azima, due to the substantial and valid excuses, including sickness. So Allah intends every facility for you. He does not want to put to difficulties. The rule of rukhsah is permissible, mubah to perform. Rukhsah can be applied to eliminate difficulties that are not severe or not in extreme need. It is also permissible to apply rukhsah unless she is particularly compelled to do so. Example, she does not find any other alternative and she firmly believes that doing so will save her from the harm. So regarding rights of the fetus in Islam by Dr. Syed Muhammad Muslim, the rights of fetus from an Islamic perspective includes the health of the mother. Pregnant woman is allowed to break her fasting, possess a risk to her health or health of her baby. The well-being of the mother directly impacts the well-being of the child. Mother has to stay away from anything that is harmful for the fetus. It also demonstrates Islam's concern for the well-being of the unborn child. So my next case scenario is about a 30-year-old man with underlying RVD on 12-hourly conviver insists on fasting. So what should be our response? So about this topic, HIV, it is actually a global issue. So we would like to point out a study which was done in Nigeria regarding adherence to antiretroviral therapy during Muslim Ramadan fasting. So the study states that annual fasting during the month of Ramadan is observed in Muslim countries, some of which have widespread HIV infection. For example, Nigeria. So they studied treatment adherence and customary practices among 142 fasting and 101 non-fasting patients on ART therapy. So it states that adherence on ART among fasting and non-fasting patients are similar during Ramadan, which is 96% and 98%. And ever since commencement of ART, 80% and 88% respectively. This preliminary study suggests that adherence and drug taking frequency appear uncompromised in fasting HIV-infected patients on ARV treatment. So what is Combivir? Combivir is a combination of both zidovudin and lamivudin. So it is taken twice daily at the exact time to ensure therapeutic concentration and reduce risk of drug resistance and treatment failure. So according to MOH Protocol Medication Therapy Adherence Clinic for this retroviral disease, it is stated that adherence issue during fasting month not to fast until CD4 is high enough and viral load is undetectable. So hence, based on the discussion for such patient, we have to discuss with the patient and respective doctor if the fasting is deemed to be safe and the medication timing can be rescheduled, then he is obligated to fast. If not, the patient is not obligated to fast and it is compulsory for him to pay fidyah. However, if the patient is among the needy and he is unable to pay fidya, then he is not obligated to pay fidya. That's all. Thank you.
Thank you very much for the presentation from Group 8. I think you can close your presentation. We move to the panelists. Prof. Amin, Dr. Nazmus, Prof. Ibrahim, any comments on the presentation?
Yeah, maybe I can give a very short comment. Thank you very much. I think the group number 8 and group number 7 have done very good presentation. First one is Ruqsa, and the second is Fiqh Ibadah. In fact, Fiqh Ibadah is a title for all whatever you are doing. So the title here is very general, but it should be Fiqh fasting, Fiqh Siyam, because the example you give is Siyam, because Fiqh Ibadah include whatever being discussed here. That is, Ibadah here is how the Muslim perform his religious duties or her religious duty. And that is why Muslims, when they come to discuss this topic, usually they started very rationally. How they do, they start by the first chapter. First chapter is a tahara. Tahara is a purification. Because a Muslim to do ibadah, the most important ibadah here is salah, and salah must be purified. So you must learn how you purify yourself. So as you are doctors in hospital, within the fiqh ibadah, you are more concerned about specific topics, like topic which you have just mentioned, that is fasting. Because patient maybe don't know how to fast during that. But I think the two major topics which you need to learn are ruqsa and darura. Ruqsa and darura. Ruqsa means license, just in literal terms, license not to performing the religious duty as prescribed by the religion. That means I can. Opposite of the ruqsa is the azima. Azima means to carry on the duty as being prescribed. As being prescribed by God, I do, that is called azima. If I need to change, I need license from God to change, not change by myself. Okay, so that is called ruqsa. And the example you give earlier, and right now this group number 8 also indicate, actually ruqsa follow the different kind of religious duties. So may you try to detect and know the ruqsa in different cases. In your case, I think the most important here is ruqsa not to do purification as prescribed. That is what you mentioned as, or the previous group mentioned as, not to do wudu, but to do tayammum. Tayammum is ruqsa. Wudu is azima. Wudu azima. Why? Because that is what God described it. Prescribe us to do a specific way. Of course, before that also there is another topic related to the purification, which we call it ghusl. Ghusl, number 1, that is a purification. Ghusl is to wash yourself. For example, if the lady gives birth, then she needs to do ghusl. If the man dream at night, then need to do ghusl. If couple sleep together, they need to do ghusl. That is the purification before you perform your duty. So we have 3 topics related to the purification now. Number 1 is a ghusl. So may you need to know this in hospital, because some patient may be need, but not so much. Second is wudu. Wudu is a purification to perform salat or even to dua and so on. But it is compulsory for salat, wudu. So these two azima. That means I do as it is prescribed. The third one is alternative, which is, we call it as tayammum. Tayammum means if I am unable to do wudu, I can do tayammum. If I am unable to do ghusl, also I can do tayammum. So this is, we call it badal. Badal. Badal is alternative. Okay, so that is one of the things. When we come down to the other chapters after the first chapter here is what? Is tahara, that is a purification. Then we go to salah, number 2. Number 3, then we go to the other rukun Islam, which are 5. Salah, that is prayer, fasting, zakah, hajj. Your case also, hajj also comes. Sometimes maybe the patient want to do hajj, then consult you. Okay, and so on. The 5 rukun come. So your case, you go through all this, and this we call it fiqh ibadah. Fiqh ibadah, that means include all these 5 chapters plus 1 chapter, which is the very beginning, that is the purification, tahara. Tahara. So you need to learn. Actually, the best of thing which I'm learning from you is our doctors, even the non-Muslim one, they are very well acquainted with the Islamic teachings. And this is a really, we consider you are international doctor, because you can invite it to work in Saudi, in Nigeria, where is the community Muslim as like you are in Malaysia, your patients are Muslim. So you need to know you are a doctor, but your clients are taking different religion or different culture. So you need to know this culture to deal with them, to make your medication effectively done. So I really believe that what this Kulliyyah doing is producing international medical doctors. International, I say. Why? Because you can work everywhere. Everywhere you can work. Why? Because you are already trained to know, especially the Muslim cases. Of course, the conventional case also you know. So this is, I think, should be taken. So I'm suggesting that the title which you put fiqh ibadah, of course, maybe this is given by your supervisor or maybe by the organizers, but it should be reduced to the fiqh fasting, siyam, fiqh siyam, because that is your cases and the focus also there. So I believe this holistic picture which I am trying to give should be taken, and then when you go inside, then you identify which part you are addressing. Just like your case, group number 8, you are addressing fasting, that is siyam. So within the fasting, you know that what is azima in fasting and what is rukhsa in fasting. Number 3, what is darura in fasting case. So when you know this, then you already mastered that chapter. Then you go to another chapter, maybe Swala. We have 5 chapters. Of course, there are 6, because the very beginning, which our ulama usually they start is what? Chapter of purification. That is tahara, as they call it. And then you know how I purify myself if I am Muslim. What kind of things I should use to purify myself. For example, water. Not all water is possible to purify me. Okay, so that is why we differentiate between water which is tahir and tahur. Tahir is something halal made drink but cannot clean. Tahur is allowed to use and allowed to purify. Purify means, for example, wudu. Wudu, the water must be tahur, not only tahir. Okay, tahir may be, for example, the lemon juice is tahir, I can drink, but I cannot do wudu with it, or cannot be wash myself, which we call it as ghusl. Ghusl cannot be done. So these are the issues usually you master, not of course today, but as you are carry on the career of a medical doctor, then you need to learn these chapters, 6 chapters. one by one, and then basically, so you can work everywhere now. You invited, you can work everywhere. I'm sorry I took a long time, but I'm just trying to draw the holistic picture, not only for your group, but even the other groups. So when you talk any topic, then you should know where I am, which one I am talking about, because we said we have six chapters. Thank you.
Excellent. Thank you, Prof. Ibrahim, on the very insightful. Please take note, yeah, group 7 on all, group 8 on all the things that has been done. We move along straight to group 9 for their presentation. Thank you very much, group 8.
Thank you.
Group 8, are you with us? Group 9? Group 9, are you with us? Sorry. Group 9 members?
Yes, the group 9 members.
Yeah.
Yes, the group 9.
You can share your video so that we can highlight it and you can start sharing your screen. Yeah. You can start and proceed with your presentation. Thank you.
Okay.
Taking a while, maybe perhaps another group member can be sharing. Whoever is sharing, can you stop sharing first and then let your group member start sharing their screen? Okay, perfect. Just need to change it to full slideshow view, yeah? Yeah, okay. Please begin. Abdullah, we cannot hear you, Akil. So we can see Abdullah, but we cannot see you. So we can hear you. So maybe you can start.
Assalamualaikum warahmatullahi wabarakatuh. My name is Yusuf. We are from the group 9. So today we will present about Haji and it's a case scenario lah. So this is our team members, includes us with our supervisor, AP Dr. Muhammad Iman. So, introduction of Hajj. Hajj is the 5th pillar of Islam. It's the pilgrimage to Mecca and its surrounding. So all Muslims are obligated to make Hajj once in their lifetime, if they can afford it, and otherwise able to do so. So dalil of Hajj, وَلِلَّهِ عَلَى النَّاسِ حِجُّ الْبَيْتِ مَنِ اسْتَطَاعَ إِلَيْهِ سَبِيلًا. So meaning that Allah has made the pilgrimage to Baitullah obligatory upon mankind for whoever able to find their way. So the Prophet Muhammad also emphasized the obligation of performing Hajj in his saying, meaning that Islam is built upon 5 pillars. And the fifth one is performing pilgrimage to the house of Allah, Baitullah. So this is an image of Baitul Haram. This is Kaabah in the center. So the ritual of Hajj date back to the time of Prophet Ibrahim and commemorates his willingness to sacrifice his only son, Prophet Ismail alayhi salam. Abraham was tested by Allah to sacrifice his son Ismail, and Iblis, the devil, appeared to and tried to dissuade Ibrahim, but he rejected the temptation. Having rejected Iblis, when Ibrahim attempts to kill his son as he has been commanded to do, Allah replaced him with a ram to sacrifice instead. The three spots where these events took place are now marked by pillars in the desert outside Makkah, known as Jamarat. So this is the picture of Jamarat. During the Hajj pilgrimage, pilgrims symbolically stone these pillars to reenact Ibrahim's rejection of Iblis and demonstrates their own rejection of evil. So for Hajj, there is a condition which is syarat to perform Hajj. So the first one is Islam. So it's not obligatory for and not valid for non-Muslim, including apostates. So and then sound mind and berakal, non-obligatory for people who are not sane and not valid if done. Puberty baligh, not mandatory for children but valid if done. However, it does not abrogate the obligation to perform Umrah during after adulthood. And capability, istita'ah, which is capable in terms of physical and wealth, capable to perform the worship rituals on your own or with the help of an assistant, badal Hajj. And independent, merdeka, not obligatory for slave, but the worship is valid and rewarding if it can be done. So introduction of Hajj, pillars of Hajj. There's pillars of Hajj, which is the first one, Ihram, entering into a state of consecration before reaching the Miqat, which is designated boundary points with the intention of performing Hajj. The second one is standing in Arafat, at least spending the afternoon at the plain of Arafat on the 9th of Zulhijjah, making supplication and prayers. Tawaf, circumambulating the Kaabah 7 times in the counterclockwise direction upon arrival in Mecca. Sa'i, walking 7 times between the hills of Safa and Marwa, which commemorates Hajar, search for water for her son Ismail. Tahallul refer to the act of removing or shaving of the hair on the head after completing the major ritual of Hajj. And tertib, the sequence of Hajj, the order and procedures followed in performing the Hajj pilgrimage according to Islamic law. So this is the picture of Kaabah during the COVID-19 time, where they perform the tawaf in the counterclockwise direction. So the Hajj is performed during the specific Hajj month, which start from the 1st of Shawwal with Ihram until the end at the dawn of the 10th of Zulhijjah. Most of the specific ritual for it are in the between 8 until 12 of Zulhijjah. So in the 8th Zulhijjah, we call it Yawm Tarwiyah. The pilgrims enter to the state of Ihram and head towards the Mina, where they spend the night. On the 9th Zulhijjah, we call it Yawm Arafah. The pilgrims proceed to the Arafah after dawn prayers, after Fajr, and they perform wukuf in the Arafah. So, and at the 10th of Zulhijjah, we call it Eid al-Adha or Yawm al-Nahar. Pilgrims perform the symbolic stoning of the devil, Rami al-Jumarat, in Mina by throwing pebbles at 3 pillars. They also perform Korban and Tahallul on the 11th, 12th, and 13th of Zulhijjah. We call it Yawm Tashriq. pilgrims continue to stone the pillars of Jamarat in Mina each day after midday Dhuhr prayers. Hajj ends officially on the 12th or 13th Zulhijjah, depending on the pilgrim's plan. So, what is the mandatory parts of Hajj? The first one is intention of Hajj in specified, we call it miqat, and the ihram is one. The second, avoid prohibition during ihram, overnight mabit in Muzdalifah, through Jamrat Kubra on 10 Zulhijjah, overnight in Mina on 11, 12, and 13 Zulhijjah, and through all the three Jamrat on the day of Tashriq. So, benefit of Hajj in health. For the public provides an opportunity to implement public health measure and disease prevention strategies on a massive scale. The large gathering of pilgrims allow for coordinated vaccination campaign, disease surveillance, and health education. It also reduces the health inequalities as the public health measures implemented during the Hajj benefit pilgrims from diverse socio-economic background. This includes providing access to the healthcare and preventative service. And the third one, establishment of an international center for public health research and coordination to study and address health risks at mass gathering like the Hajj. So, benefit of Hajj in person, similarities among humans. The meeting of Muslims from around the world often highlights the deep similarities among them despite coming from different cultures, ethnic backgrounds, or countries. The Hajj experience provides a unique opportunity for social support and community bonding among the pilgrims. So, training oneself to sincerely dedicate action solely for the sake of Allah subhanahu wa ta'ala involves cultivating a deep spiritual intention and commitment. Training to prepare to live the worldly realm dunya refers to the spirituality and mental preparation to face death and the hereafter, deepening the quality of prayer with focus and full awareness of Allah. Prayer is a direct connection with Allah and helps prepare mentally from separation from the physical world. Sorry. So, benefit Hajj in person also, training to the shape of Muslim personality involve a comprehensive approach that integrates spiritual, moral, and ethical development, upholding high ethical standards in personal and professional life, guided by Islamic principles of justice, integrity, and respect for others. The physical health benefits. The physical demands of Hajj pilgrimage, such as walking and performing rituals, can improve overall physical health. Supervised exercise program for pilgrims have been found to be a positive effect on their physical and mental condition. So this is our reference. So we move on to the case discussion and the case scenario. For the first case scenario, when a 50-year-old man with underlying hypertension comes for screening for Hajj eligibility, you note that his renal function is CKD stage 5 and he insists on going for Hajj. So what is your response? So for Hajj worship is encompasses jasmania, and which is badan and physicality, beside of spirituality. Those concept of istita'ah, which is mean capability, need to be understood. It is obligatory to perform Hajj or Umrah only to those who are capable. Being capable is not only financial, but physical and healthy body and mind also part of the body. So prospective Hajj who suffer from high risk and unstable chronic disease does not meet the obligatory Hajj requirements, which is has status. There is ayat Quran from the chapter Ali Imran, verse 97, which is walillahi 'alan nas hijjul baiti man istata'a ilaihi sabila, and due to Allah from the people is a pilgrimage to the house, and whoever is able to find thereto a way. which is we look at the words of istita'ah, which is able or capable. One of the syarat to go to Hajj is a capable istita'ah. And one of the Hajj requirement by government of Saudi Arabia, every prospective Hajj also needs to pass a health examination with the criteria and guidelines set before allowed to depart for the Holy Land. Prospective pilgrims must be in good health. Only individuals with chronic disease who have been confirmed to be stable and has passed the health examination based on the criteria in the health examination guidelines edition 9, which is in this year, are allowed to perform Hajj. So in this scenario, based on the garis panduan kesihatan edition Bakal Haji edition the 9 edition. So a patient with a chronic kidney disease, there are failure criteria, which is stage 5, like in this scenario, or stage 4 with uncontrolled comorbidities, or patient chronic kidney disease with on dialysis and functional class 3 and 4. So we as a medical officer, we need to perform our duty trustingly, amanah. Like in the it mentioned from in the Quran, from chapter Al-Anfal, verse 27, Ya ayyuhalladzina amanu la takhunu Allah wa rasul wa takhunu amanatikum wa antum ta'lamun. And who have believed, do not betray Allah and the messenger, or betray your trust while you know the consequence. So in this scenario, we cannot pass the patient to go to the Hajj, to perform Hajj. It is in sync with our maqasid syariah, which is hifz nafs, to preserving life. So based on this is a quotation from the Muzakarah Jawatan Kuasa Majlis Fatwa Kebangsaan in 2008. It mentioned that the patient who has a chronic disease and no hope for cure, to be cured, like a chronic kidney disease on dialysis or like that, it's not compulsory for them to perform Hajj. And chronic disease patient, they compulsory to do badal haji. Badal haji means that they perform a Hajj by proxy for those who are unable to perform the Hajj. And this Muzakarah said that chronic disease patient have to do the badal haji if they istita'ah, capable in financial. And for those who have a chronic disease, after the disease has been cured, he need to do the Hajj if they are capable. And in this is quotation from the resolusi Muzakarah Kebangsaan in 2020. It mentioned that in number 7, severity of chronic disease which prevent physicality to do the Hajj has to be decided by the medical officer. So also in the same Muzakarah in 2020, in the chapter of istita'ah, means capable. Istita'ah amniyah, which is capability and safety in perform Hajj worship. It includes safety from the different aspect, which is the first one is life, second one wealth, and also it includes number 4 is safety in health. So we move to the next case, the second scenario. A woman plans to perform Hajj and request medication from you to delay the menstruation. So the answer in this scenario, we refer to the Pejabat Mufti Wilayah Persekutuan Al-Kafi number 478, which is it is permissible for those women to delay the menstruation, but there is a discussion. The first one, basically, women who are menstruating are allowed to perform the act of Hajj other than performing tawaf in Baitullah. So, in the words of Prophet Nabi Muhammad sallallahu alaihi wasallam to Ummul Mu'minin Aisyah radhiyallahu anha, do as the people who perform the Hajj do, except that you do not circumambulate the Baitullah until you are pure. So, but it is permissible for the woman to take the medication to delay period as long as the medication not causing harm to the woman with advice of a doctor. There is a quote ayat Quran mentioned in Surah Al-Baqarah, verse 185. It means that Allah want to ease for you and He does not want hardship for you. And in the Qa'idah al-Fiqhiyah, which is al-Mushaqqaqah, al-Mushaqqah tajlibu taysir, which is the hardship begets the facility. Al-Imam Al-Bahuti Al-Hambali rahimahullah said that it is permissible to drink medicine that are legal to cut menstruation as long as it is safe from any harm. So we need to know that the medication have to be safe from the harm, as the Qa'idah Fiqhiyah said that ad-darar yuzal, la darar wala dirar. Conclusion, so the conclusion is religion allow the use of medicine as long as it does not harm humans. So we move to the case scenario number 3. A vaccine refuser with the intention of performing Hajj. Can you allow him to go Hajj? So the answer, a vaccine is a must based on the we refer to the Pejabat Mufti Wilayah Persekutuan Irsyad Hukum number 30. The discussion here is vaccination is a simple, safe and effective way of protecting people against the harmful disease before they come into contact with them. So for Hajj, the compulsory vaccine, which is a meningococcal quadrivalent vaccine, a requirement from the Saudi Arabia authority. Optional vaccine that we have, influenza vaccine and pneumococcal vaccine. Performing Hajj which involve a great numbers of people, those vaccine is required to prevent any communicable disease. The same action was the action of Sayyidina Umar Al-Khattab when he did not enter the cholera epidemic area and was asked by the commander of the faithful, are you afraid of Allah's judgment and you run away from it? Sayyidina Umar Al-Khattab replied, I ran from the qadar of Allah into his qadar. This was stated by another friend, Abdul Rahman bin Auf, who mentioned in the hadith of Prophet sallallahu alaihi wasallam, which means when you find that there is a cholera in the area, then do not approach that area. And if you are in the affected, if you are in the area affected by cholera, then do not run away from that area. Rawahul Bukhari. So this tally in parallel with our maqasid syariah in the preserving life, hifzun nafs. And the words of the messenger of God sallallahu alaihi wasallam from Abu Darda radhiyallahu anhu, which means indeed God has sent down disease and cures, and He has made cures for every disease. So you all treat yourself and do not treat yourself with things that forbidden. So the conclusion, individual health is a demand of a religion and life where it will be benefit the life of all mankind. In these issues, vaccines are no longer a personal wish, but this preventive material is now a need for social in general. I think that's all from us.
Thank you very much. Can you please close your stop sharing your slide for now? Group 9. I would like to open the floor to maybe Prof. Amin first.
Bismillahirrahmanirrahim. Thank you for the doctors from Group 9. I think it's very lengthy and then quite detailed in terms of the Hajj and then the few scenario that you discussed just now, and I think is as specialists because we are the one who going to certify whether the I mean the anybody who are going to Hajj, whether they are eligible or not eligible. This is actually is a part of our job to do, and then most of the time they are referred to us to see whether it's eligible or not eligible, which is I think is we need to know quite detail in terms of where and when they are able to go, especially is the words istita'ah ataupun capability of the patient or not the patient who are having a problem. In particular, when they have the chronic disease, which is I think nowadays the tabung haji also have the better, or I mean not better, but it's a strict rules to allow that patient to choose to be going to for Hajj. They are not make sure, they want to make sure that they are actually is a fully healthy when they are there. So that's come to our role as a doctors who are we are supposed to certify them whether they will need to go, because according to the fatwa, there actually is there are certain numbers of patient, a certain disease that actually is not allowed, which is actually is an advanced disease or whatever. But somehow in the tabung haji, the ruling actually is tighter than that. So I'm not really sure. Maybe you have other panels can give the opinion as well. Means that those who are having diabetic, uncontrolled diabetic is not allowed to go, which is I think is going to be ruin a lot of patient who are actually already prepared whatsoever for Hajj. Suddenly, because they are actually is already uncontrolled diabetic or the complicated diabetic, they cannot go. Similar thing happened to the patient with a renal problem. In dialysis, or definitely they cannot go because the facilities is not good enough today. But in a certain things that they need to require, which is actually is a tighter ruling that applied by Tabung Haji for this one. So I think is by we want to follow the fatwa, yes, of course, but somehow the ulul amri part actually is also the thing that we need to consider. That is actually is so we as specialists or the expert in the field, we should have a voice in terms of giving the advice to the tabung haji, as well as when come to the certified patient, whether they can allow to go or not to go. Because this is a things, a responsibility which is amanah which is given to us. Okay, I don't have much comment on this one, but I think it's a good presentation. The only thing is that maybe you can discuss about the issues that actually is recently, which is it's applied to the tabung haji to all the people who are going to Hajj. Thank you very much.
Thank you, Prof. Amin. Prof. Razak, would you like to have any comments? I think Prof. Razak is with us now.
Oh, thank you very much for notifying me. I actually enjoyed listening to the presentation, but in general, and I think it was good presentation. But one comment, that attracted my attention was not on the health and medical side, but I think the presenter did mention that if I correctly remember that, some sort of like he made a connection between the Hajj, making Hajj, as an obligation, and the issue of Nabiullah Ibrahim, getting, a dream to, his son, to sacrifice his son. And I think the presenter did mention that, that kind of, maybe because the Hajj is there because of that, incident, Nabiullah Ibrahim, sacrificing his son, and then, the devils, somehow disturbing him, and then he throw, stones. So I think if I correctly remember, that is what attracted my attention. I think the Hajj obligation is much more than that. Yes, Nabiullah Ibrahim did it. Yes, we follow Nabiullah Ibrahim. Yes, he and his son built the masjid or Baytullah there. But I think the obligation of Hajj is not only connected to that incident, but it's part of the Islamic teachings and principles. It's a general guideline. I think maybe the presenter wanted to say something and I understood something else. I'm giving him, the the opportunity of doubt, but I wanted to notify that part, if that was what he said, then I think we need to go, to understand Hajj wider than that. Although that incident is important, Nabiullah Ibrahim and his son is important, but the obligation at Hajj is much more than that. With regards to, I wanted actually to ask Prof. Amin and also the presenter, the medical doctors, the clinicians who are in the session, what is the latest, how do I say, what is the latest, medical or clinical, opinion about the, the incident, well, how do I say, incident or phenomena that is now becoming, prevalent among the female Hujjaj, whereby some female are taking some medications to delay the menstruation, right? So because the fuqaha, they will say that as long as it's medically okay, they say, as long as it has no medical implications, right? As long as it has no healthy complications, the fuqaha will say, okay, they don't mind. They say, okay. So I wanted to ask, are there cases where a female has used that kind of medication to delay her, menstruation during Hajj, or maybe for other reasons, and then there were some health complications? So what is the latest update? I just want to know some information, or I want to learn from the clinicians in the session. Back to you.
Okay. To answer the Prof. Razak question, I think in the discussion just now we already presented some of the guideline that we have, and then in between the fatwa, and then what kind of cases that especially is medication who delayed the menstruation, which is actually is I think it's a lot of people already use it, and then currently use it to this one, because certain fuqaha, certain fatwa say that there is actually allowed to use it for the whatever purpose somehow. But there is I remember there is one discussion in terms of this done between the Fiqh people. I can't remember which conference, but they said it depend on the it's actually up to the person what is their intention, especially if they think following the fitrah actually is better for them for the sake of the taqwa, which is I think there's a few concepts that they're mentioning. I can't remember which one, but this may be better because that is what Allah wants. Actually, it's not really changing but also there is something that you have the intention, so that we can actually perform, especially for the Hajj, because the time actually is very, very limited, very quick, about few days only, a few hours only, so that we want it to be done as possible. But again, when we listen to the fuqaha in Saudi say that, I mean, it's a lot of the leniency actually is allowed in this group of lady, so that they can actually perform, they can put a letter whatsoever. So which is the most important thing. when it come to the Hajj, only one thing they are not allowed is to the actually is tawaf in the Kaaba. Others actually is can do as usual. So this is come to a lot of a question, but actually is what I heard in term of this one. Maybe correct me if I'm wrong, but they are depend on the what they actually is intention of the person itself. If they want the taqwa, they want to follow that fitrah of Allah subhanahu wa ta'ala give to them, it's actually is they have a lot of things that they can change or they can modify. But at the same time, they want to continue with the ibadah without interruption. They can actually take it when for whatever reason, not only for the disease itself. But I don't see any other things that can have prevent or delay all these things. In terms of a disease, like those who are actually have a problem with the menstruation, mean the menstruation always prolong everything. I think maybe it's advisable for them to take it as well. So at least they can be back to the fitrah, back to the normal timing of the period. Allahu alam. Maybe I think is I'm not the expert in this this thing of
Okay, I
the
mean, sorry
gynecology
to,
or obstetrical reason.
sorry,
But maybe that is a good thing to discuss, inshallah. Yeah.
yeah, Doctor, I mean, sorry to interrupt. I just wanted to know, is there any, what about the clinical and healthy wise? Is it, are there cases where a woman delayed her menstruation and it has caused healthy complications? Is there any research? What the literature, what the medical literature says about it?
So far there is not much of the problem. I'm not sure about the long-term problem, but because taking the medication to delay it later, once you take it out from this one, then the menses is going to back to normal.
Oh,
Usually
okay,
it's
It
not
doesn't
okay,
have a
a problem.
long-lasting impact and
It's
effect.
not long-lasting.
okay,
This is only just a
okay.
temporary measure that we do. That is,
But we don't have.
I remember. I think is our gynecologist mentioned something like that. We don't have a much of a problem when we stop it. The menses will come back as a normal. The only thing
Okay,
is for the that
okay,
particular time, maybe we need to
sure,
actually have
sure, sure,
All right.
sure.
Very interesting
Okay.
topic and also open for more debates later. But in the interest of time, I would like to invite the final group before our morning break, group number 10, for their presentation. Uh, uh, so I invite group 10 to share your screen as well as start your presentation. Thank you very much. Group 10 members, can you identify yourself?
Yes, Prof.
Can you see the slide?
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh. I'm Dr. Ana Shahiran, Obstetric and Gynecology program, Master's program. We are Group 10. Our supervisor is Dr. Ashikin. So we are given the task to discuss regarding abnormal uterine bleeding, which is a topic that is in favor of me particularly, because in ONG is a commonly discussed topic, its causes, and also to comment on the situation given. So next, please. So we'll start off with the definition. So abnormal uterine bleeding, in general, is a range of symptoms. So normally, a patient who comes with symptoms such as heavy menstrual bleeding, prolonged menses, any intermenstrual bleeding, postmenopausal bleeding, or even a combination of those heavy and prolonged menstrual bleeding is considered as abnormal uterine bleeding. So menses, by definition, is a normal monthly cycle shedding of blood and tissue from the lining of the uterus when pregnancy does not occur. Next, please. So in Sharak, when we talk about menses, it's basically a natural discharge of blood from vagina of a woman while she is healthy for a certain period of time. When we talk about menstruation, there's of course the discussion of istihadah. So what is istihadah? So istihadah is basically an irregular uterine or vaginal bleeding due to an illness at the end of the vagina known as al-anzal, which occurs after a maximum duration of menstruation or lochia, or continuous blood flow after the normal days of menstruation. Next, please. So when we talk about the causes of abnormal uterine bleeding, we always refer to this mnemonic called palm coin. So some book put it as PALMCOIN and other would put it as PALMCOEIN. So what are those? So we go one by one. In terms of structural causes, one, the P signifies polyps. So polyps can be endometrial or even cervical polyps. Then second is adenomyosis. Adenomyosis is a subsidiary of endometriosis, whereby the stromal tissue is basically within the myometric tissue and causes inflammation. L is for leiomyoma, or also known as uterine fibroids. M is malignancy or any hyperplasia for that matter. Then we move on to the non-structural causes. So when we talk about non-structural causes, there is this first C is coagulopathy. So any von Willebrand disease, any platelet disorders, these are all causes of coagulopathy. Then ovulatory dysfunction. So patient with PCOS, patient with primary ovarian failure, those are the patient under ovulatory dysfunction causes of abnormal uterine bleeding. Iatrogenic are those patients with hormonal contraceptive, any hormone replacement, or even a post-surgical case. And last but not least is not otherwise specified. Like for example, patient with PID, endometritis, cervical erosion, or even atrovenous malformation. Next, please. So the case that was given to us is a 30-year-old woman who has irregular menses, but usually her menses cycle range from 10 to 14 days. So for that particular month, she still has menses up to her 20th day of menses, and currently it is Ramadan. Next. So we go one by one. So looking at the patient's demographic, a 30 years old woman who is basically still at her reproductive age. We talk again about irregular menses. So when we talk about irregular menses, it's basically a condition characterized by abnormal variation in terms of frequency, duration, and amount of the menses blood. And if their cycle length is less than 21 days or more than 35 days, accompanied by less of very severe blood flow. When we talk about prolonged menses, menorrhagia can be defined as a complaint of heavy cyclical menstrual blood loss over several consecutive menstrual cycles in a woman of reproductive years, or more objectively. So a total menstrual blood loss of more than 80 mils per menstruation is considered as heavy or prolonged. And when we talk about Ramadan, so basically Ramadan is a fasting month where in that particular month, if a woman were to have menses, so they are excluded from performing the fasting practice. So from Sahih Al-Bukhari, basically he said that Islam is built on 5 pillars. So testimony that there is none worthy of worship except Allah, establishing salah, giving zakat, hajj, and fasting Ramadan. So we are trying to emphasize that Ramadan is important, but what if it is the case for women who have this abnormal uterine bleeding? Next, please. So the question again, can she perform salat as well as fasting? What is the explanation and the reason? So the problem identified is the irregular menses, which normally for her is 12 to 14 days, but now it is extending to 20 days during Ramadan itself. So can she be allowed to pray and also to fast?
So, Assalamualaikum and hi. I'm Fakra Aiman from Radiology Department. So, I will continue regarding this case scenario. So, first, the introduction. The definition of menstruation, as Dr. Anas mentioned before, this is by Shara in the Al-Fiqh Al-Manhaji. Logically, head means flowing, while the meaning of head, according to Shara, is natural and normal blood, which is excreted from the vagina of a healthy woman who has reached maturity in certain time. So head, according to Shara, is a natural discharge from the vagina of a woman while she is healthy. This is according to Al-Wajid, so more or less the same meaning. According to the above definition, it can be understood that head blood is blood which flows during the normal time of a healthy woman. Thus, abnormal bleeding is considered caused by a disease is not head and considered as fasad blood or istihadah. In Al-Fiqh Al-Manhaji, istihadah is defined as diseased blood which flows through the vein at the end of the uterus, which is known as Al-Azil. This is according to Al-Fiqh Al-Manhaji. While istihadah according to Shara is in Al-Wajiz fi Al-Fiqh Al-Islami mentioned as irregular discharge from the lowest vein located under the uterus, which is known as Al-Azil, after the longest period of normal menstruation cycle, postpartum bleeding or blood discharge continuously after the normal menstruation cycle. It is considered if any of the following happens, which is blood discharge 2 times with a gap of pure that is less than 15 days, blood discharge after the longest period of 15 normal menstruation days, blood discharge for less than 24 hours is also considered as istihadah, blood discharge in before the age of 9 years old, before the puberty, and blood discharge after the period of 60 postpartum bleeding days. So this is the timetable counting of the period of pure. So as you can see, the red color is the period of menstruation cycle. So the minimum considered duration to consider as menstruation is at least 24 hours. But the normal women had menses around 7 days. But there's also some who had disease where the maximum menses up to 15 days. So as you can see in this table, the period of first menstruation cycle and to the next second menstruation cycle, there is a gap which we call period of pure. So meaning that this period of pure, women should have no discharge or blood. So the minimum, the period of pure, considered as period of pure is 15 days, normal 23 days, or maximum is limitless because there's some women that have period every 6 months. So the important criteria that should be taken into consideration from this definition is the blood which flow at certain times. Among the times are the minimum, maximum, and usual times of menstruation. So this is what I elaborate in the timetable. In Mazhab Al-Shafi'i, the minimum duration for menstruation is a whole day and night. Fatwa issued by Imam Al-Shafi'i in and held by the Ashab. The meaning of a whole day and night is 24 hours, as stated by Sheikh Al-Islam Zakaria Al-Ansari in his book, which means the duration of day and night, which is for 24 hours. The duration for the bleeding of 24 hours may be irregular. If a woman experiences irregular menstruation for 4 days, then it adds up to 24 hours. Then on the 4th, she will consider as has been menstruating for a day. Afterwards, if the bleeding stops, then starts again after a few days. The duration when the bleeding stops, or also stated as the knockout duration, it is still considered as the menstruation duration according to the final opinion. Why, according to the second opinion, through the mazhab Syafi'i, throughout the nakat duration, a woman is considered as pure, and her prayer and fast performed during this time is accepted and considered valid. So the condition for the irregular bleeding is that it must not be exceed 15 days for it to be considered as menstruation. If it exceeds 15 days, then the entirety of it is considered as disease blood and not menstruation. Thus, if after 15 days have passed out, but the bleeding doesn't complete the 24 hours, whether it is continuous or irregular, then if she experienced bleeding after the 15 days, then it should be considered as the start of menstruation. The following we state all the conditions for the nakat duration to be considered as menstruation if the nakat duration does not exceed 15 days together with menstruation. The nakat duration is included in the menstruation duration of not less than a whole day and night, and the nakat duration exceed the usual fatrah, which fatrah means the duration of which bleeding does not happen, which blood doesn't flow. But if cotton is inserted in the vagina, there will be traces of blood. So in this duration of fatrah is considered as menstruation without any khilaf from the scholars. So basically, based on the question, the scenario given, this patient, the red line is the duration menses, while the yellow is the continuation of the menses beyond the 15 days. So can she perform solat as well as fasting? Okay, so this is for this patient. The first head is 10 to 14 days. And the yellow box is we consider as the minimum period of 15 days. So in between 15 to 20 days for this patient, from day 15, is still considered head. But for day 16 till day 20, it is beyond the menstruation period. So this patient, wajib for her, I mean, it's obligatory for her to perform the prayers and fasting. For the prayers, what she must do is obligatory prayer by wearing a sanitary pad after washing her private parts, and perform ablution after the time for prayer begin, and immediately perform the prayer, don't delay the prayer, and to take ablution for each of the obligatory prayer without having to perform obligatory bath. And this patient wajib to perform fasting. So based on the timeline, day 1 to day 15 is considered as head and haram for her to perform prayer and fasting. Day 16 to day 20 we consider as istihadah. So wajib to do the prayers and fasting, and the steps are mentioned before. Day 20 till day 29 is considered as pure. So wajib to perform prayer and fasting. So that's all the conclusion for this scenario. Thank you.
Thank you very much, Sister Fakira. Shahiran, is that the end of your presentation?
Yes.
Yeah, okay. All right. Can you, I would like to invite Prof. Ibrahim. Are you with us still?
Yeah, okay. I think the presentation is clear, short, and also good example given. Only one comment, that is our ulama, when they write these issues, usually they were not supported by medical doctors. So they estimate everything to differentiate, for example, between hair and istihada. The period given there is their ijtihad, just to differentiate between the normal menses and also what is because of disease or because of illness. I believe that is why in our time we have medicine, we have capability, we have ability to check and then know this is normal or abnormal. So the time mentioned and the things given or the estimation given, this is in their time. Maybe they are focusing on those things just to give estimation. But in our time, I think we should depend on the medical doctors. Medical doctor can clearly tell us exactly this is due to disease or it is matter of normal prolonged menses. Maybe this is one point, but actually I was willing to maybe, if you allow me to go back to the previous presentation, I want to clarify something, but maybe I give the chance for my colleagues if they have any comment about the specific this case. If not, then you give me a chance to go back to the other.
I'll go to them first and cycle. If it's okay, and I'll come back to you, Prof.
Yeah, better.
Dr. Nazmus, any inputs?
No, thank you. No input. I give my time to Prof. Ibrahim.
All right. Prof. Amin? And Prof. Razak?
I have no comment on the program. I think it's quite clear in terms of the groups of people, what the definition of the heights, what is the definition, and the istihadah, everything, which is, I think, for us doctors, we have to be very clear the determination, because we need to decide. We need to decide when actually is considered allowed as a height, and then this is actually is memang they are nullified or actually is can release from doing the ibadah in terms of that one that they cannot do. But in term one come to istihadah, this is a few things that they can do. Even there is the bleeding, they can actually is doing proper packing and everything, and then they can perform. This is actually is a very clear. And then in terms of disease itself also, I think remember the first speaker mentioned about all the list of the disease, which is actually is when come to the hukum last time, they don't really know what exactly the source of it, and then now the medical is advanced, so they know what is exactly the cause, whether there is actually there is a systemic disease or is a local disease, then can give rise to the problem. So we want to have some sort of, we need to actually discuss, together the medical expert with the fuqaha, with the fiqh, the ulama, in terms of determine what exactly, because once come to the advancement of the technologies and the medicines, everything, they will show us there maybe some changes in terms of the fiqh in a certain part of this due to our advanced knowledge in the disease. That is actually things that maybe is a go forward for us. Our specialists, young blood who are going to be a specialist very soon, to actually dig and then do the study in terms of this one, so that they can come out with the exact things that benefit all the other fraternity, inshallah. Thank you very much.
Thank you. Prof, I would like you to hold for a while, because I think I'm going to give the floor back to Prof. Ibrahim, and I'm sure the questions
carry on.
and queries that he will ask will probably need your input as well into it. Prof. Ibrahim, I pass it back to you.
Yeah, thank you very much to giving me just because earlier presentation was a lot of discussion happened, and I think that is very good. Prof. just highlighted about the advancement of medicine here. So we consider medical doctor is a judge who takes the decision, and then the fuqaha give the rule based on the decision given by the medical doctor. And that is why when we go to Hajj case, the concept of istita'a, capability. So earlier our ulama mentioned capability in many points, including the monetary ability, that means enough money to go, physical ability, and also safety of the road. I think in the fatwa of Malaysia, they mentioned about 4. But who determines this is a medical doctor, mainly. So what we need to understand here, when ulama discuss this capability, they want to say that when this conditions are available, that is capability is there or ability is there, then it is wajib or not wajib. That is the issue here. For example, compulsory for me to go or not. This is what they want to discuss. So if, for example, today I got enough money, I am physically fit, the road is safe, so now it is wajib for me to go or not. This is what they want to discuss. This is in their time. So, for example, if I don't want to go, I didn't go, I have enough money, ability, and so on, but I didn't go, then suddenly I die. So, do I am in Masiyat or not? That is what they want to discuss. So, they bring the issue of wajib immediate or wajib prolonged. Tarahi. Some ulama wajib tarahi, some ulama say no, it is immediate. For example, I am a poor person, but suddenly some of my relatives passed away. He left a lot of money, so I became millionaire today. So it is wajib for me to go or not. So this is what they discuss. But the medical doctor not discuss this wajib. No, it is fit to go or not. Fit to go or not. So the license which is a medical doctor go, for example, the case of vaccination. So the medical doctor may say, going to Hajj without vaccination is dangerous. So I consider you are not fit. So the person takes that license to excuse not to go, because if he died, then he know that he was not fit due to the there is no vaccination, for example. Or the person is fit to go, but the government say no, this year Malaysia got less percentage, so your year or your capability will be next year. I am fit to go, but the government says so. So this is a ruler. I think Prof. Amin indicated to this about the role of the government. So now if I die, I didn't go, but I died this year. So do I am in Masya or not? So this is the question raised by ulama. So I consider I am not in Masya because the government said that you are not capable to go this because the percentage given to Malaysia already finished. So what I mean is this is the part which you need to play. So as you are medical doctor, you play the role to identify the case of the ability rather than fit to go. Fit to go. Because actually I was in 1994 and 1995, I did Hajj 2 times because I was in Makkah. I found very old people, they say that I come here just to die. See, he is not fit, he cannot work anything, but he want to die there in Makkah, and that's why they come from Nigeria, from very far away. They are very old people. I say, why you need to come? Because you are not fit. He said, no, I want to die here. I want to die. Yeah, so this person, if you say don't go, give as medical doctor, you are fit not to go, then he get angry with you. You are bargaining. But that is a fact which you need to mention to him. Then he go die, then it is up to you. That is near between him and God. So I believe the first case which you mentioned in the last one is really controversial and raising a lot of this is most frequently raised question. So if you are a medical doctor, you need to get ready when the high time comes. Many people, many patients will come and put that question. So you are able to have a very clear view on this. Thank you very much.
Okay. Prof. Amin, you want to have any concluding remarks before we go for the break? Especially on things that Prof. Ibrahim has touched on.
You want to respond? I think Prof. Ibrahim mentioned actually is very true. You know, is you when come to this ibadah, everything, we have our personal interests or personal needs. You want to go. If you ask me also, I actually want to die in Haramain. You know, this is the best place for you to die. So if everybody want to die in this part, what we're going to happen? We have to think about that also. But there is a true, fairly true regarding the you have to balance between what is a government, ulul amri, what they have decided, because most of the time they have the advisor, we have the council who give the advice in terms of the ruling, especially in terms of go for Hajj, everything. And then this is according to what have been discussed, the mashwarah they have made. And then this is for the sake of or the for maslahah of ummah, rather than actually it's for the personal reason. But for us, we have our own personal interest. So there looks like it's a conflict in between these two, but actually it's not really, because when we actually we as a Muslim, as a person who we want to be the best of our interests. But once come to this one, when come to the conflict between the whatever we want and then whatever ruling which is imposed on us, we have to actually put it as a balance. What if they are not allowed, but there must be a reason. For example, that mentioned by the Dr. Ibrahim, Prof. Ibrahim just now, is in terms of a vaccine. Last time they imposed that no vaccine, no Hajj, no Umrah, nothing. But actually that is considered temporary. Now actually they never ask about the vaccine. And then a lot of things actually happen. So most important for us, we have to understand what is the needs, what we should do. Make dua to Allah Subhanahu Wa Taala, make effort for all these things. Inshallah, Allah Subhanahu Wa Taala will open. That is for individual, but the whole things, whatever it is, selagi the government is not imposed something which is against the Sharia, we have to follow them. Okay,
Thank you very
that's
much.
all by
Oh,
me.
that's
That's
very
what
nice.
I thought.
That's very
Thank
nice
you.
on how you put it for the closing remarks, I think, Prof. Amin. That comes to conclusion on our morning session. I would like to thank all our panelists as well as to students. We have about 10-minute break before we are going to come back in at 11:40. Please don't be late, especially to the group that is presenting, because we want to keep it time and we want to finish just around the time zone starts. Thank you very much. With that, Assalamualaikum warahmatullahi wabarakatuh, and meet you back here in 10 minutes. Thank you. Assalamualaikum.
فجرا جئت بعد العسر يسرا ربنا أعلاك قدرا يا إمام الأنبياء أنت في الوجدان حي أنت للعينين ضي أنت عند الحوض ري أنت هاد وصفي يا حبيبي يا محمد يا نبي سلام عليك يا رسول سلام خير رسل ربي من به أبصرت دربي يا شفيعي يا رسول الله أيها المختار فينا زادنا الحب حنينا جئتنا بالخير دينا يا ختام المرسلين يا حبيبي يا محمد يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك أنت نور الله فجرا جئت بعد العسر يسرا ربنا أعلاك قدرا يا إمام الأنبياء أنت في الوجدان حي أنت للعينين ضي أنت عند الحوض ري أنت هاد وصفي يا حبيبي يا محمد يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يرتوي بالحب قلبي حب خير رسل ربي من به أبصرت دربي يا شفيعي يا رسول الله أيها المختار فينا زادنا الحب.
Okay. Assalamualaikum warahmatullahi wabarakatuh. Shall we start our second session of the day today? Okay. So, Alhamdulillah. My name is Dr. Ashikin. I'm a clinical lecturer from the ONG department. So, we're going to start the second session of our presentation today, which is the last session. It's our seminar today. So, I hope the group numbers 11 to 14 it should be ready now. Okay. So before that, I would like to remind again to all the presenter, you only have 20 minutes for presentation and 10 minutes for discussion with our expert panels. Okay. I think it's now 11:40. Shall we start with the first group? Okay. I would like to welcome group number 11. Which is being supervised by Dr. Marain. Inshallah, they will talk on the termination of pregnancy, the rules and also indication of the pregnancy and the case study. Okay. Okay. Group 11 shall begin now.
Assalamualaikum and good morning. My name is Fazlina from Group 11 with our supervisor, Dr. Marain. Now we begin our discussion.
You can share your slide now.
Mana nak share? Tolong aku. Cuba. Sorry, kejap
Okay.
Dia tak pandai buat ni. Nampak tak? Tak di. Macam mana? Boleh nampak ke?
Not yet. Fazlina.
Lemah depan aku. Sama-sama share. Okay. Share. Oh ni. Apa ni? Apa dia buat? Okay. Tak boleh. Boleh. Tak boleh apa? Dia kena open system. Kenapa tak boleh share? Boleh ke? Boleh tak? Siapa nak share slide?
Anyone of other group members that have the slide, you can share also.
I'll share a screen for you.
Yeah. Make it as a slideshow.
Okay. Assalamualaikum. My name is Fazlina. Representative from Group 11. We will talk about termination of pregnancy. So supervised by Dr. Marain. Next. So before we move on to the introduction of the termination of pregnancy, there's a two case scenario that we will be discussed in this session. So first case scenario is an 18 years old woman primary gravida at booking 12 weeks period of gestation, premarital conception, request for termination pregnancy as she felt stressed of her pregnancy. Second scenario is a 40 years old woman recently divorced 1 week ago, noted to have missed her period and her UPT test is positive and she requested for termination of pregnancy. So before we discuss about the cases, I would like to introduce about what is a termination of pregnancy, the rules and indication and the complication of TOP. So abortion and termination of pregnancy is the expulsion of a fetus from the womb of the woman. This may be carried out either by consuming a certain drug or by entering the womb through the process of suction. It can be legal or illegal. So termination of pregnancy is performed usually to save the life of the pregnant woman based on clinical judgment, aligning with the Quran and Islamic medical expert opinion. So globally, abortion mortality accounts for 13 of maternal death. Leader combination of unsafe procedure, untrained provider, restrictive law, high maternal morbidity and mortality coexist together. So in Malaysia, we have a guideline for termination of pregnancy for government hospital that developed in 2012. You can download in the website lah. So purpose to have the guideline is to create awareness among the practitioner on complexity of issue of induced abortion and of existing provision and on complexity of induced abortion and ethic legislation, religion and reproductive right of patient. So it developed based on the local custom and practice from the other countries, namely UK, Australia and Singapore. So there is some terms that we need to know. First, unwanted pregnancy is defined as a pregnancy that was not planned for or not desired by the couple or the mother at the time of conception. So sometimes this may be due to an abnormality of the fetus or of an illness of the mother. So abortion is defined as an expulsion or removal of an embryo or the fetus from the uterus at the stage of pregnancy when it's incapable or independent survival, either less than 500 grams or less than 22 weeks of gestation. It may be spontaneous miscarriage or induced for medical and social reason. So as mentioned before, termination pregnancy is purpose confined to procedure to remove the embryo or fetus where the pregnancy is less than 22 weeks of gestation, or its gestation is unknown where the fetus is estimated to be less than 500 grams. So usually patient that refuse to continue a pregnancy, they may underwent unsafe abortion, which is the procedure for terminating an unwanted pregnancy either by person lacking the necessary skill or in the environment lacking the minimal medical standard or both. So next, indication for the termination based on the medical indication, either to save the life of the pregnant mother, to preserve the mother's physical or mental health, to prevent delivery of the fetus detected to have a serious defect. Next, there's a legal aspect, civil code. In Malaysia, induced abortion is illegal under Act 574 of the Penal Code, revised in 1997. However, an exceptional clause has been added to Section 312. A medical practitioner registered under the Medical Act 1971 who terminates the pregnancy of the woman if such a medical practitioner is of the opinion from a good faith that the continuance of the pregnancy will involve risk of to the life of the pregnant mother or injury to mental or physical health of the pregnant mother greater than if the pregnancy were terminated. So in addition, Section 314 indicates that if the process termination of pregnancy result in the death of the mother, they would constitute a criminal offense. Next, so we have the Islamic jurisprudence council regarding the Islamic fiqh. If proven by the a committee of the at least 2 competent and trustworthy medical experts on the basis of medical examination with the use of appropriate equipment and laboratory findings before 120 days of pregnancy that the fetus has serious anomalies that will be present at the birth. Only it is permissible to abort after the request of the parent. When the pregnancy reaches or is beyond than 120 days, abortion becomes totally forbidden and is deemed a form of murder that result in prosecution unless the continuation of the pregnancy to full term poses a risk of mother's life. Abortion shall then be considered permissible. So this decision must be based on the opinion of at least 2 competent and trustworthy medical experts in the field. So this ruling was based on the revelation derived from the glorious Quran. No soul shall have imposed upon it a duty, but it to extent of its capacity. Neither shall the mother be made to suffer harm on account of her child. So next, So, Muzakarah Jawatan Fatwa Majlis Kebahasaan 2010, there are 3 category in the Muzakarah Jawatan Fatwa. Bagi pasangan suami isteri yang sah, disebabkan kecacatan yang teruk dan penyakit yang mengancam, makruh menggugurkan janin yang berumur antara umur 1 hingga 40 hari sekiranya tidak mendatangkan bahaya pada ibu, mendapat persetujuan kedua-dua suami isteri. Perguguran janin yang berumur sebelum 120 hari adalah harus sekiranya janin itu cacat dan berpenyakit yang boleh membahayakan nyawa ibu. Dan pengguguran janin yang telah berumur 120 hari atau lebih adalah haram kerana pengguguran itu dianggap satu jenayah ke atas janin yang telah ditiupkan roh, kecuali pengguguran itu untuk menyelamatkan nyawa ibu disebabkan kecacatan yang teruk. Second kriteria bagi pasangan luar nikah, either rogol ataupun zina, haram menggugurkan kandungan janin yang berumur lebih daripada 120 hari kerana pengguguran itu dianggap satu jenayah bunuh ke atas janin yang telah ditiupkan roh, kecuali pengguguran itu telah menyelamatkan nyawa ibu. Pengguguran janin yang berumur lebih daripada 120 hari adalah harus sekiranya janin itu cacat dan penyakit teruk yang boleh membahayakan nyawa ibu. So, under zina, pengguguran kandungan zina adalah haram dalam semua keadaan kecuali mengekalkan kandungan akan memudaratkan nyawa ibu. So, bagi golongan orang kurang upaya, OKU ujian akal di bawah paras 80 harus menggugurkan kandungan yang berusia kurang daripada 120, haram menggugurkan kandungan yang berusia lebih daripada 120 kecuali memudaratkan nyawa ibu. So, previously I was talking about the law of the TOP. So how about the right of fetus in Islam? So sanctity of life. Life begins at conception. In Islamic teaching, life is considered from the moment of the conception. The Quran and Hadith emphasize the sanctity of life and this extends to the fetus. So protection of the unborn, the fetus need to be protected and nurtured. Termination of pregnancy is generally prohibited except in the case of the mother's life is in danger and in case of severe fetal anomalies. So, right to life, general prohibition on abortion. Abortion is generally prohibited in Islam. The prohibition is based on the principle of preserving life, which is considered one of the 5 essential maqasid al-Sharia of Islamic law. So, exception if the pregnancy poses significant threat to the mother's life or health. So some scholars permit abortion within the first 120 days of pregnancy if there is a compelling reason, such as severe fetal abnormality. So right up to recognition and identity, establish of paternity. So the fetus has a right to have its paternity recognized. This is particularly important in the context of marriage or divorce, where the waiting period that we call in Islam iddah help establish the paternity of the unborn child. Identity and lineage. The child lineage is protected under Islamic law, ensuring the child's social and family right. So, few complications of termination of pregnancy. One of that hemorrhage, which is low risk 1 in 1,000 abortion. Uterine perforation, moderate risk 1 to 4 in 1,000. Uterine rupture, very low risk, less than 1 in 1,000. Cervical trauma, moderate risk 1 in 100. Failed abortion depending on method used such as surgical or medical abortion. So post-abortion patient may develop infection up to 10%. Psychological sequelae, high risk of psychological illness or self-harm. So as I mentioned before, we have 2 case scenario. Basically, in summarize, both of these cases show that as a medical practitioner, we are in dilemma when have a case of teenage pregnancy or mother with just divorced 1 week ago and wanted to terminate the pregnancy. So how we approach this case in a case. Next. So in Malaysia, as I mentioned before, safe abortion is legal if the pregnancy threatens the woman's life and or health. Important of considering Makasi al-Sharia and medical ethics, particularly the preservation of the life and mind in decision making to prevent unsafe abortion and associated risks. So decision must be balanced between in the ethical principle of beneficent, non-maleficent, and justice. So we need to provide comprehensive counseling and psychological support to the mother, as well as considering her mental and physical health as essential part in this process. So effective primary care, counseling, and family support are crucial in managing this case. So,
Dr. Fazlina, Dr.
yes.
Fazlina, you have 5 minutes more.
I sikit je, Ustaz. I
Yeah,
put
okay.
every case in holistic manner. An interview session with the pregnant woman, husband, and family member have to be made. We should offer for psychological support and cost monitoring in primary care level. Psychiatric input may needed for psychotherapy, and if we needed for antidepressant, then we need to prescribe to the patient lah. So next, consideration for the divorced wife. In the iddah period after a divorce, a woman observe a waiting period known as iddah, which typically lasts for 3 menstrual cycle. The purpose of iddah is ascertain whether the woman is pregnant, thereby establish the paternity and safeguarding the right of the unborn child. So about the right and responsibility, the husband must have a responsibility towards the pregnant wife and include financial support during the pregnancy and childbearing. So next, for the ethical and legal consideration, termination during there is a complex issue would require strong justification, such as a mother's health being at the serious risk. So decision should ideally involve consultation and knowledgeable Islamic scholar and medical professional. So impact on paternity and inheritance. If the woman pregnant in the iddah, the paternity of the child must be established. The child rights to inheritance and the father responsibility must be considered. So next, as summary, so practical step in our life, how we handle this case. Consultation, the pregnant woman should consult both medical professional and religious authority to understand her opinion. Multidisciplinary approach ensure that all aspects, include health, legal, and religious, are considered, and we need to document properly. And justification of any decision made are crucial. So this includes a medical report, fatwa, and any legal permission required. So my last slide, conclusion, premarital pregnancy has direct relation with the unsafe abortion and baby dumping cases. They need and require our serious attention from the society to prevent serious mental and physical complication. Issue of termination of pregnancy in divorced wife within Islam is a sensitive matter that require careful consideration of religious, ethical, and legal principle. So decision should be made with the guidance of the both medical expert and knowledgeable Islam scholar. So closing top, important of the culture and religious sensitive in the healthcare, the role of Islamic medicine in promoting holistic well-being. So next, I end my presentation with Surah Al-Baqarah. Kutiba alaikumul kitalu wa huwal kurhul lakum wa asa an rohu syai'an wa huwa khairul lakum wa asa an tuhibbu syai'an wa huwa syarrul lakum wallahu ya'lamu wa antum la ta'lamun. So fighting has been enjoyed upon you while it is helpful to you, but perhaps you hate a thing that is good for you, and perhaps you love a thing that is bad for you, and Allah knows why we know not. Thank you.
Alhamdulillah, thank you to the presenter, Dr. Fazlina, for the comprehensive presentation regarding the termination of pregnancy. So now I would like to invite our expert panels to give any comments or maybe some questions to the presenter and also the group members. Okay, yeah, inshallah, maybe Prof. Amin. Prof have any comments to the
Can I just
presenter?
Yes,
Thank you, Prof.
can I just start with saying thank you for a good presentation. In terms of the content, I think it's good. I just wonder in terms of the definition of abortion include the abortion of dead fetus. You get what I mean?
Sorry, Prof.
Dead fetus mean the baby already died. Is it considered abortion or not
Oh.
in the definition?
If the fetus already died without the intention of
Yeah, it's already died. Is it considered abortion if you take it out?
no. Maybe it died because due to other medical condition without intention of the parent mother to terminate the pregnancy.
Okay, so when come to the dead fetus inside the mother's womb, so what is the hukum or what actually is the you know is it permissible to abort it or what is the reason behind it? Anybody from the group? Maybe you already read about this this thing. I mean, this is taking babies from your body. It's still considered abortion, but what is the hukum behind it? Or you maybe want to talk regarding the maxim of it?
I think if the fetus is already dead, there's no heartbeat, then normally we will proceed for abortion because keeping a dead fetus in the mother's womb is actually harmful for the mother. She will eventually go into septic shock. So in those cases, we will actually proceed for abortion, medically induced abortion.
Yeah, I think I agree on that because that is a part of the treatment. You have to treat because when they are already dead in the inside the uterus, they are considered burden and disease. So we have to take it out from this. So it's actually you need to actually do the abortion. It's a part of the treatment. Okay, I don't have a much comment in terms of the abortion, but if I this one there is a full principle that usually we follow. You have to know why the 120 days time actually is important. You know, most of things that they decide 120 days. So what do you think the reason behind it? Anybody from the group, maybe you have read what is the reason behind 120 days in the development of the fetus? Why most of the hukum and everything that come with this time, 4 months. Less than 4 months is okay, but the 1 month it is not permissible to do that. Any particular reason?
Yeah,
Anybody?
anyone can take the question.
I think it's when
One of the group members.
I think it's when roh ditiupkan kepada janin, I think, if I'm not mistaken.
Yes. Yes. Anything else?
It's probably also when organogenesis will be complete in the first trimester.
Yes, I think you have to consider both of it, isn't it? Both of it when there is already ruh inside. Then this is in particular, this is according to the ayat Quran that we mentioned about when the ruh actually is go to, and then there actually is already life consider. Okay, so that's the reason why, because whenever you do it, without any valid reason, after that 120 days is considered killing. Okay. I think that's all my comment. Just want to ask a few questions, whether you understand what they are talking about. Thank you very much. Maybe inshallah other panel will maybe want to continue.
Okay, Assalamualaikum.
Waalaikumsalam, Prof. Ibrahim.
This is Dr. Najmus.
Sorry, Dr. Nazmus, sorry.
Yeah.
Sorry. Yeah, Dr.
I
Nazmus.
would like to just have a little bit of understanding of the case scenario 2. A 40-year-old woman recently divorced 1 week ago, noted to have missed her period. Her urine pregnancy test is positive and she requested for termination of pregnancy. what is the Malaysians rulings, legal rulings, Islamic rulings, divorce, and your medical perspectives on this? How do you consider this? Anyone from the group? Because when you are pregnant, it is not allowed to have divorce, right? Islamically. So how the divorce was pronounced, or which party here is wrong?
Anyone can answer?
Case scenario 2.
I think the divorce isn't sah, as in it's not finalized, but the question is they are separated. So yeah, the talaq isn't sah. They're in the process of separation. But
How you
according to the
consider sah?
slides that were
As you are claiming the talaq is sah, how
this
you are
is a
claiming it is
your
sah?
someone else.
Okay, can I answer? As far as know, once we are divorced, we have a 3 month what we call 3 kali suci. I mean 3 three cycle after menstrual cycle. So as in this case, supposedly the woman should go to the Mahkamah Syariah and to tell the Mahkamah Syariah said that she's pregnant. So the talak will be postponed. She need to stay with the husband, and the talak the divorce is not considered as divorce.
Exactly. Yeah, that's the true understanding. And the way the divorce should not be announced before. Why these 3 months of or 3 menstruation is recommended in Islam? Because maybe even medically it is proven. I heard. I think I read one paper. Even after 3 months, pregnancy can be detected. So like Islam and science, one course was taught during that time. I forgot, but the analogy of these 3 months, missed period of reason of this, that pregnancy could have been even detected after 3 months. So this, in this case, we cannot say the divorce has been taken place. Rather, it would be postponed. Maybe Prof. Ibrahim or Prof. Abdul Razak can enlighten us on this, because this is something serious you need to taken care of as a medical doctor.
Thank you, Dr. Nasmus.
Okay, just maybe
Prof. Ibrahim.
short comment about this. In fact, the divorce is take place in 2 ways: divorce in Sunnah way and then divorce in not Sunnah way. Sunnah way is just like what Dr. Nasmus saying. So if in period or in a pregnancy, then it is Sunnah, not should take the divorce. But if practically took it the place, it will be valid or not? This is a question which the court will mention, and the countries sometimes are different in this question. For example, today, somebody make a divorce in not Sunnah way. He didn't follow. His wife is pregnant, but still he give a divorce. Or the lady is in her period time, but still he give divorce. He get angry, very angry. So this will take the place or not? So this is a question which our candidates maybe to find in case of Malaysia. But I think generally they consider the divorce will take place, but not in Sunnah way, not in Sunnah way, not that right way. So legally it is take place. But this also based on the fiqh which you follow. Some fuqaha say it is not valid. That is what Dr. Nasmo is saying. The others say no, it is valid, but it is not Sunnah way. This is maybe one point. But maybe just I continue to give maybe some comments. In fact, the divorce, or what we call, not the divorce, sorry, the abortion and termination of pregnancy, I think this is very, very good topic and frequently. And I'm sure you are the doctors, always you are being tested here. Some people, some ladies come and just request for termination. Maybe they not only asking you, it is allowed or this allowed, but they ask you to conduct the process itself, giving tablet or whatever is it. So that is one problem. So it is the termination of the pregnancy, really it is raising a lot of problems. As we see today, for example, in USA, the two candidates are fighting about this. Okay, one say I will allow abortion, the second say I do not allow. So, but in our communities, in the Muslim communities, we follow Islamic guidelines. Not only Islam, actually, even many of the Eastern countries do not allow abortion, except few cases, even the Western also. So few cases abortion is allowed. So I was thinking that our candidates maybe try to find a little bit controversial cases. Controversial here means, for example, rape case. Rape case, because there is two criteria. Our ulama determined to terminate the pregnancy. The age of the fetus. That is maybe what Prof tells you according to the 120 years mentioned by the hadith, and what is the reason for fixing that time. I think very good test. Second, also the question of how the pregnancy happened between the two couples, or it is rape case, or it is zina case. That is a controversial issues. I hope you try to focus in your cases, and I hope that if you bring the rape case, then you compare, that is pregnancy happening without consent of the lady, number one. Number two is maybe the age of the fetus, when it is being permitted to abort such baby. Is it within below 120, or even after that, and so on. So what I mean here is legal pregnancy and non-legal pregnancy as well. So you are create a controversial issue, so you solve the problem. Because this is a what we call frequently cases which happen. The normal one between two couples is not a real problem, not real what you call as controversial, the couple one. So only the you mentioned the case of the 18 years one. I think that is very good one. Okay. The second 40 years one is you fix it with a divorce. That is why question rise there. But what I understood is maybe pregnancy discovered after yeah, after that I'm solving the problem of Dr. Nasmus now. Pregnancy, maybe divorce happened, then after a few months, then the lady discovered that she is pregnant from the previous husband, and that is why maybe the case happened. I'm not sure, but I think the pregnancy is very good and practical issue. So I hope maybe you can study the more controversial issues, not the normal one. Your case focus more controversial issues, so you are able to solve. If you get in trouble, then you may consult somebody. Thank you.
Okay. Okay, thank you, Prof. Ibrahim. Alhamdulillah. Thank you for the constructive comment and feedback from the Prof. So I think we should move on to the next group. Thank you to the group 11 for the great discussions.
Sister Nur
And
Ashkin,
then, okay. Sorry?
can I comment before you move to the next?
Yeah, sure.
Very quick one,
Prof.
very
Razak?
quick, very quick one, yes.
Yeah, sure, Prof. Razak. Okay.
Yeah, I was listening to our experts and to the presenter as well about the issue. So I think the issue of divorce and the other issue has already been commented, but I just wanted to add my voice to the comments given, about, the issue of the aborting the, the baby there, the growing embryo. I think Prof. Amin already raised, the question about the reason of 120 days and, beyond and after and before, right? So actually, that's a very good point, is to remember, and I think to share and remind our students as well, and also our expert. It's like, previously in the class, the classical fuqaha, they did mention that, before 120 days, they some of them allow it, they permitted, abortion, the baby, the baby can be aborted for different reasons, right? But after 120 days, they said no. That is the classical, fuqaha's position, some of them, majority of them. But in contemporary and modern fuqaha, they actually, majority of them disagreed with that kind of position, because that was, according to them, that was, based on the understanding that the growing embryo is not alive before 120 days, based on the hadith of the Prophet, in which the Prophet ﷺ said 40 days, blood, and then 40 days congealed blood, 40 days mudgha, 40 days alaqa, right? So 3 times of 40 days, 120 days. So for them, based on that hadith, they assume, or they understand, that growing embryo cannot be aborted after 120 days, because the hadith says that it's been ثُمَّ يُنْفَخُ فِيهِ الرُّوحِ. But before 120 days, they said it's permissible to permit to abort the baby, the embryo, the growing embryo. But the contemporary fuqaha, they disagreed with that. Majority of them, they said, wait, according to the hadith, ثُمَّ يُنْفَخُ فِيهِ الرُّوحِ, after 120 days, ثُمَّ يُنْفَخُ فِيهِ الرُّوحِ, which means a soul, or this is what ensoulment takes place, or the process of or the stage of ensoulment takes place after 120 days. So for them, they assume that the stage of ensoulment means life, right? And Islam protects life. Therefore, life cannot be terminated once the ensoulment of the embryo takes place. That was the classical position. So the contemporary position says, well, look, you guys are confused with what the hadith said and, the terms. Because here, the hadith says, ثُمَّ يُنْفَخُ فِيهِ الرُّوحِ. The hadith didn't say that ثُمَّ يُنْفَخُ فِيهِ الْحَيَاةِ. The hadith didn't talk about life. The hadith talk about ensoulment. And ensoulment, or soul, or ruh, is different from hayat. So the contemporary ulama are actually more towards what the clinicians or bioscientists are talking about, which is, according to the contemporary ulama, right after the transfusion of the sperm and the ovum takes place, actually that zygote is alive. Hayat, there is a hayat there. Because if that zygote is not live, it wouldn't grow. And it wouldn't, go into embryo and then later on baby and so forth. So basically, according to them, the contemporary ulama, they said the sperm was alive and healthy, and the ovum was also alive. Therefore, the transfusion take place. One is the ovum is being fertilized by the, the sperm. Then this zygote is alive and it grows up into embryo, and there is a life there. And Islam aims for protection of life. Therefore, Islam aims for protection of life, and this embryo is alive. Therefore, one is the transfusion of the I'm using maybe non-medical language, so please you excuse me, you forgive me on that. Maybe you guys use a different word, not transfusion. Transfusion is used for the blood, I think. What was the other word? There was another word.
Fertilization.
Fertilization, yes. So once the fertilization takes place, then that zygote is alive, and therefore it's prohibited to terminate that life. So that means according to contemporary fuqaha, majority of them, including Sheikh Yusuf al-Qaradawi, Allah yarhamuh, they are on the view that one is, the pregnancy is initiated, then there is no, justification of aborting it. So that is prohibited to abort it. So not only after 120 days of installment, but even before that, once the fertilization takes place, then there is no issue of aborting it. So that means basically there is no abortion right from the beginning of the pregnancy in that case, according to contemporary fuqaha. Why? Because contemporary fuqaha, they classify between ruh and hayat. What the hadith talk about, the installment, that is the characterization of the human being, the ruh. But this characterized embryo, now humanize it, shape it as a human being, given ruh, this embryo is been alive right from the beginning, 4 months ago. That's why medical doctors, after 7 weeks of the pregnancy, they look for heartbeat, right? Heartbeat means there is a life there, right? So the ulama, contemporary ulama said no abortion right from the beginning of the pregnancy. So back to you. I just wanted to add that small addition of what is being said. Shukran.
Alhamdulillah, thank you so much, Prof. Abdul Razak, for enlightening us. I think this is a very good information from the Prof. Abdul Razak that we need to consider during consultation or the explanation to the patient. Okay. So we should move to our next group. I would like to welcome Group 12. Group 12 will talk about medical leave, the rights and also the indication of the medical leave. Group 12 is supervised by Dr. Norazwani as well. Okay. You can share your slide.
Okay, Assalamualaikum and very good afternoon to all respected panels, moderator and my
Waalaikumsalam, Dr. Ayuni.
My beloved fellow PG colleagues. I'm Ayuni on behalf of Group 12, supervised by Dr. Azwani, will present and brief regarding our group assignment, which is pertaining to medical certificate. This is the members of our group. Okay, for medical certificate definition, it is a legal document or certificate that can only be issued by a registered medical practitioner for the purpose of certifying that a person suffers from an illness sufficiently severe enough to be excused from their work or duties. So who has the rights to issue MC? According to Malaysia Medical Act 1971, a fully registered medical practitioner is a person recognized by law as a member of medical profession. No certificate or other document required by any written law to be signed by a duly certified qualified medical practitioner given after the commencement of this act shall be valid unless signed by a fully registered medical practitioner. And for the indication for MC, a person is entitled to use medical sick leave when he or she receives medical examination and treatment and is incapacitated for the performance of duties by physical or mental illness, injury, pregnancy, or childbirth. And it should be only issued after the registered medical practitioner has performed an appropriate consultation with the patient, including the history taking, physical examination, and also investigation where it is necessary. And if the registered medical practitioner in his professional judgment feels that the illness is so trivial as not to interfere with the patient's work, he may choose not to give a medical sick certificate. However, an attendance note may be given to certify attendance at the clinic. So a bit sharing about MC, according to the Employment Act 1955, employees are entitled to medical sick leave of 14 days in each calendar year if the employee has been employed for less than 2 years, 18 days in each calendar year if the employee has been employed for 2 years or more but less than 5 years, and 22 days in each calendar year if the employee has been employed for 5 years or more. And if hospitalization is necessary, the employee is entitled to an additional 60 days leave. So pertaining to the first case scenario given to us, 40 years old man requests medical leave for his cough, but upon your assessment, you noted that he is completely well. How would you respond? So the first one is by giving the reassurance to the patient that for the time being, he is not entitled for medical leave as he is healthy, well, and fit to work with current condition. We also need to educate them and remind ourselves as well that deception to qualify for sick leave are blameworthy in Islamic law. Allah Subhanahu wa Ta'ala has always commanded his servant to speak the truth. In Surah Al-Tawbah, verse 119, he says, for you who believe, fear God and be with those who are true. So by giving the medical certificate to those who are not eligible for it, we are actually not being honest to ourselves and break the trust that is given to us. However, as a good medical practitioner as well, besides being honest and responsible, but at the same time, we also must have courtesy or ihsan to our patient. So we should explain to him and provide him at least a light duty letter during the day of the illness. We also should remind him if the condition is worsening, such as fever or sepsis, he should seek back medical advice, and at that time, medical certificate can be issued to him. Here, regarding the second case scenario, a 28 years old woman requests medical leave for taking care of her 7-year-old children who are currently having day 1 fever due to tonsillitis. Would you give? How would you respond? So as an ethical medical practitioner, we need to explain that medical leave is entitled for those who is sick and not able to perform their duties after consultation and physical examination by medical practitioner. So granting the mother medical leave without assessing her for any illness so that she can take care of the child is considered as dishonest and misusing the authority of medical practitioner in issuing the medical leave. However, we can advise her to take emergency leave instead to take care of the child, or we can provide supporting letter informing her employer that the child is unwell and requires caretakers, which is the mother. However, if the child develops symptoms of illness such as contagious disease, such as chickenpox or hand, foot, mouth disease, she should bring the child for the treatment. And at that time, we can issue a quarantine leave for the mother to take care of the child. So that's all from our group.
Okay, thank you, Dr. Ayuni. I would like to invite any experts here to comment on the presentation.
Okay, Bismillahirrahmanirrahim. Can I say something? This is a medical leave. Medical leave is okay. This is a medical leave. It's actually a very important issue because in our whole people, we are the only group that can certify the medical leave. That is, I'm not sure whether it's a privilege or it's actually a burden to us because our eligibility. Okay, the first thing, the first comment actually is you are based on the Employment Act 1955, which is very long. Do you know that this is a new Employment Act 2022, isn't it? Do you go through this 2022 Medical Act, Employment Act in labor law? Because they are saying something different in terms of the medical leave. If I'm not mistaken, correct me if I'm wrong, maybe you have to check again before you send the report, everything. Because there is no more medical leave now. They consider hospital leave and sick leave. If you are admitted to the hospital, you have a certain numbers of leave that can allow, and then for the sick leave is different, and then for the hospital leave is different. Because hospital leave can be up to, if I'm not mistaken, up to about 90 days something, but the sick leave is about maybe 15 days, something like that, which is you just check with the new Employment Act of 2022, which is supposed to be implemented now. Because I think it's for, as a medical doctor, so you should know that. Okay. So that is implication, because last time the medical leave they lump sum together on 90 days for both when you hospitalized as well as when you have got sick leave. But now they separate it so that there is a certain numbers of it actually is implied for the people. So this is something that you have to know also, because you are the one who signed, give the leave. Okay. In terms of the fraud of giving the leave, medical doctors, they should know when to give a medical leave. This must be a good reason to give a medical leave. Whenever patient visit us, they are entitled to give a leave. To see the doctor, or whether they got the disease or not disease, they are entitled already to get the leave. But how long it depends on this one. Maybe it's a local people, they can reach the doctors within that few hours. Actually, is the day leave is good enough to see the doctors. But maybe from the outside, which is takes longer, maybe 1-2 days. 2 days actually is for they are traveling to see you. Actually, is a warrant to be a medical leave. That is what I understand by the leave given to those who are come for the consultation. But like we in myself in orthopedic, we tend to give a very long leave because we are eligible. Most of the patient, we have a fracture, we are incapable, or all the etc. that you mentioned just now. We can give a very long leave, but not all. I don't think so. That's not all. Some of the disease actually is you think depend on how fast the recovery of the patient. And then most of the time when come to the giving the medical leave, we need combine with the light duty. In fact, you ask all the insurance company, they don't allow you to give a medical leave. After that, you go back to work straight away. Most of the time, they want you to be weaned off from the medical leave to go light duty, and then only to go back to work. Because the medical leave, they entitled full payment, and the light duty, they will entitle for the half payment. So this is a thing I think maybe you need to actually is updated ourselves in terms of once come to this one, get the full for information regarding this thing, which is because the main thing that I want to know is to this one, because you are entitled, not entitled, you are actually is a person who are going to sign and chop your name there. So you are responsible to whatever you give to the patient. Honestly, honesty, and then the trust, everything is a depend. If we don't actually is entitled the request by the patient. Patient request, doktor boleh tak bagi cuti kat saya? Without any concrete reason, we can't really give the medical certificate. That's the reason why they all kata, oh, susah kalau hospital government susah, baik pergi GP yang boleh bagi apa semua. That is up to that is their problem. It's not our this one, because the patient, sometimes they are shopping a few GPs to get the day off, something like that. But actually there is a things that happen in our community lah. But for us actually is there is about the trust as well as the amanah for us, and then we are responsible to give it according to the indication, proper indication. Okay, wallahu a'lam.
Sure. Thank you, Prof. Amin. Is there any other third panel that want to give any comment to the presenter? Or
Yeah,
maybe
Prof.
any
Amin
question
already summarized
Prof.
everything. But I want to just ask a question about the last scenario, taking care of baby. Is it regarded as medical MC or it is social or other kind of definition. Maybe the latest employee rule maybe give different definition to that kind of things. Maybe one of you or even our panelist, Prof. I mean, if you have any comment on that, on taking care of the baby or somebody sick from the family members, how it is defined.
Sorry, Prof. Yeah.
Maybe one of the group member
Prof.
want to
Ibrahim,
answer.
yeah.
Sorry.
Maybe the other group members can answer the question. Just want to know about the your case scenario. I think Dr. Ayuni, you get the question?
Can you repeat the question, please?
Sorry, Prof. Ibrahim.
Dr.
It's
Sophie, we are
about
not so clear regarding the question.
yeah. What I understood from the second case is the person asking to take care of the baby. Is it?
Yes.
So do that is considered as MC case, or if somebody else, for example, taking care of the husband, taking care of somebody.
So what I understand is in the second case, the mother requests for MC, medical certificate, for taking care of the child. But according to the true definition of the MC that should be given, it is only should be given to those who are qualified as to be sick, not to the caretaker of someone else. But like I said previously, in terms of that, we must also be assigned to the mother by what we can do is provide some letters which is stated that the mother had to take care of the child. So the letters can be given to the employer, and it's in the consideration of the employer and between the mother itself whether to give leave to take care of the child. But in some circumstances, such as contagious disease that enable the child to be sent outside to the other caretakers except by the parents, we can give quarantine leave to the mother. It's just like it's not like MC, but it's quarantine leave.
That means maybe you need to check the baby itself. Because now I am claiming my baby is sick. Maybe there is two stations. What I am saying is because I am now coming claim that I want to take leave because my baby is sick. And then I come to you as a medical doctor. So there is two issues here. Firstly, to prove that the baby is sick. Second is to give leave. Leave, I think, should be given by the boss of the person, not the medical doctor. I believe so.
Yes.
I'm not sure, but this is maybe issue for discussion.
Yeah, sure, Prof. I think you answered the question from the Prof. Any other question to the presenter? Okay, I think that's all. Thank you to the group 12. So we almost to the next group 13. The group 13 is supervised by Dr. Muhammad Saiful. We talk about medication requests. Okay, might I get a group 13 to be ready?
Okay. Slide presentation. Where's the slide?
Can you share the slide?
Slide anyway. Where's slide? This one. Okay. Share screen. Entire screen. Can you see the slides?
Yes, I see. Make it a slideshow, Dr. Nukman.
Okay. So, Assalamualaikum warahmatullahi wabarakatuh. We
Waalaikumsalam.
presenting topics regarding ethics, medical professionalism, and maqasid syariah in medical practice. So, proceed with the first part. So, what is the ethics as being explained before? The ethics come from the Greek words, which is ethos, which denotes the character, spirits, and attitude of a nation or society. So ethics is described as a set of moral principles by which human activities can be assessed as a good or evil, right or wrong, and a set of knowledge standards of behavior for a specific category of human actions. So it's related to the akhlaq, which is the plural of khuluq, which is it refers to a person's personality, characters, and dispositions. The words akhlaq and khuluq which is also the meaning of a creator, are closely related, as it is with the words of makhluk, which is creature. So I just touch a little bit regarding the principle of medical ethics. It consists of autonomy, beneficence, non-maleficence, and justice. So the autonomy is emphasize the right of patients to make informed decisions. And the beneficence is acting in the best interest of the patients, while non-maleficence is do no harm, and the justice is fairness and equity in medical treatment and resource distribution. So the medical ethics and versus the Islamic perspective. So in Islamic perspective, we should emphasize the relationship between the ultimate healer and the patients and the treatment, which is being told in Surah Ashura, the verse number 80. The Allah Allah is the ultimate healer. So we should also to emphasize to the patients that common everyday remembrance of Allah, which is zikr and prayers in our medical practice. So regarding the professionalism in Islam, it's composed the faith, consciousness, which is also taqwa, the best character, ahsan al-akhlaq, excellent performance, itqan al-amal, and strive towards perfection, which is ihsan, and responsibility, which is amanat. So the next part, I'll touch a little bit regarding to the maqasid syariah. So what is maqasid syariah? So the meaning of maqasid is literally means that intent, objectives, and the purpose. And it can also be considered as the wisdom and knowledge behind the governing rules. And the Sharia also, the literally means that the way, a broad term for Islamic law in sense of principles and rulings. So why there is maqasid Sharia? So it is to achieve social and economic justice, as well as enhancing the welfare of community, and to provide guidance that regulate lives for the benefits of mankind, and to forbid all that is harmful to mankind, society, and the environment, and it also permits all that is useful and beneficial to mankind, society, and environmental. So otherwise, the maqasid syariah is not restricted to the just prohibitive rulings and discouraging immoral conducts and harmful actions, but it places values on promoting and encouraging righteous behavior, moral conducts, and acts of goodness. So what is the objectives of the Sharia, which includes of the levels of necessities. It includes luxuries, which is called tahsiniyat, which is
complementary and desirable factors that give perfection and additional value to human life. So Islam encourages us to achieve this purpose to have a better life. Nevertheless, Islam teaches us to pursue this goal in correct manners. So for the example, branded outfits, luxury cars, and bungalows. The next parts of the objectives is the needs, which is hayat. So it is less essential to the human life compared to the necessities, which is daruriyat. These are requirements for human beings to live without difficulties. However, the lack of any of these needs is not matter of life and death. For example, marriage, communication tools, and transportations. And the other parts of the objectives of Sharia is of absolute necessities, which is called daruriyat. These essential elements for human beings to prevent harm or damage to the basic human life in this world and hereafter. It is include 5 pillars, which is the first one is the religion, which is deen, which is Islam is the sum of belief, rituals, rules, and commandments by God to regulate people's relationship to their Lord and relationship with each other. It calls towards faith, good actions, and prohibits mischief. The second part is the life or nafs. So Islam aims to preserve human life through the establishment of set of rules to ensure its welfare, spirituality, and humanly, as well as rules to forbid the destruction of life. The third part is the intellectual, which is the akal. Indeed, the intellect is one of the greatest blessings God has bestowed upon us to make calculated decision to maintain life on earth. It is for this reason God has forbidden intoxicants which could cloud the intellect of the human beings. The next part, which is the progeny, which is the nasab. Islam aims to protect the dignity of humankind through the legitimate marriage and lineage. It's also aimed to protect the offsprings, individuals, and the community by preventing infidelity, adultery resulting in vague lineage. And the last part is the wealth, which is the mal. Sharia recognizes the individual rights to wealth and preserve it through the pursuit of lawful livelihood, trade, and exchange. Therefore, wisdom behind the prohibitions for the theft, deception, treason, and unlawful gains through the usury and or misappropriate wealth or others. So proceed with the case scenario. The first case, a son come to health clinic and requests a hypertensive medication for her mother who had defaulted for 1 month and unable to come appointment for logistic reason. So how will you respond? So according to the medical perspective, as a healthcare provider, the primary concern is health and well-being of the patients, which is the son's mother. If the mother requires hypertensive medications and has missed the appointments due to the logistical reasons, it is important to assess the urgency of the situation. But depending on the severity of the hypertension and the specific medications, some medications may be critical to prevent the complications such as stroke or heart attacks. So in terms of legal and ethical consideration, healthcare providers often face legal and ethical dilemma regarding prescribing medications without recent examination or monitoring. Prescribing medications without a current assessment could potentially lead to medical risks or complications. And regarding the Islamic perspective, preserving of life, which is his al-nafs, Islam places strong emphasis on the sanctity of life and the obligation to take the measure to preserve it. This includes providing necessary medical treatment to prevent harm and maintain health. So the principle of necessity, which is the darurah, Islamic jurisprudence recognize the principle of necessity, which is darurah, which is permits ordinary prohibited action in a case of necessary where there is genuine threat of life or health. In the context of this scenario, if the mother hypertension poses risk to health, she's unable to come due to the logistical reason, This principle may justify providing medication to prevent harm. So the recommended course of actions in this case of scenario, a temporary prescription might be given for a period 1 to 2 weeks up to a maximum 1 month, so that this duration allows the patient to manage their condition until they can properly assessed and by the healthcare provider. However, depends on the patient condition. So there is no immediate concerns. A temporary prescription might be extended to 1 month. However, there is a concern about the patient health or potential complication. So the shorter duration is advisable, which is 1 to 2 weeks. So it is wise to advise the son to encourage the mother to schedule a new appointment as soon as possible to be in order to assess her condition and adjust her medication if necessarily. So need to explain the importance of regular medical monitoring, adherence to the treatment plans, and so that the son can help to emphasize the seriousness of managing the hypertension in his mother. So the case 2, you are in a ward when a patient who are terminally ill requests for medication to end her life. She was unable to bear her pain anymore. She had been diagnosed with stage 4 lung carcinoma with multiple sites of metastasis. So in this scenario, regarding the medical perspective, patient requests for medication to end her life. From the medical ethics, we need to respect the patient's autonomy with regards to medical treatment. However, it is healthcare providers' obligation to avoid harm and do no harm to the patient as stated in the medical ethics. In Islamic perspective, beside that, the request is contradict with the preserving of life. His nas, as stated in Maqasid Syariah. There is also a verse in Quran that mentioned in Surah Al-Baqarah, ayah 195, spend in the cause of Allah and do not let your own hands throw you into destruction by withholding and do good. Allah certainly loves good doers. So what being recommended in this scenario, we cannot give medication to end her life. Instead, we should understand the patient concern, which is she wanted to relieve the pains, and that's why she resorted to the thought of to end her life. So what we can do in terms of medication, we should escalate the medications for the pain management. As maybe we should also offer psychological approach, such as we can offer the cognitive behavior therapy or acceptance and commitment therapy in management of pain. And also we should approach spiritually, whereby we should emphasize to the patient that disease is come from Allah, and Allah the ultimate healer, and close to Allah with practicing everyday remembrance or with dua also. And the third case, a patient requests specifically for Celebrats for the headache at your center. Upon your assessment, her pain score is 2 out of 10 and there is no contraindication to give paracetamol or NSAIDs. But your patient requested for COX-2 inhibitor as she believes the medication is much better than NSAIDs. How will you respond to these patients? So in medical perspective, so pain is the fifth vital signs. It's important during the routine investigation. So as a healthcare provider, should listen and respond promptly to the patient reports of pain and manage pain appropriately. So we should explore the pain. So any allergic to the drug, especially patients specifically asking for COX-2 inhibitor, there is possible other drug-to-drug interactions such as antiplatelet. We should take through history. Is there any other comorbidities? So and the first as the being stated in the guidelines, so the pain score given by patient is 2 out of the 10. So the first line of medication is paracetamol and should be reassessed after 30 minutes if the condition improve or not. If not improve, we should add on another medication. It could be NSAIDs or COX-2 inhibitor. So what being should regarding the do in Islamic perspective, Muslims are advised to be steadfast in dealing with any pain and suffering. They are confronted with sin. Such forbearance would not only lead to explains of sins, but would also be awarded with in afterlife. So in ayat in Surah Ashura, when I am ill, it he who cures me. So for the recommendation, so there is multiple approach can be done. So such as medication itself, as been stated before, and there are also another modalities of treatment, as we call it as non-pharmacological treatment, such as physiotherapies, psychological approach, or another complementary medicine such as massaging or music. So that's all from us. Thank you.
Okay, thank you, Dr. Nukman, for the comprehensive presentation. So I think I would like to open to the expert panel to comment. Is there any question to the Dr. Nukman regarding his presentation? The topic of Dr. Nukman is actually a medication request, is it, Nukman?
Yes.
And then how you dealing with that, how you respond and dealing with the patient who requests for medication.
Okay. Just a little observation.
Dr. Nazmus, okay.
In case scenario 1, it is a straightforward case of euthanasia or mercy killing. So, is there any government initiative in order to practice or to educate patients about this in Malaysia, or how normally, like in according to Islam, we know this is not acceptable, but there are methodologies to adopt. We can give him painkillers to just to or stop the taking medications in order to expedite the death or anything, but we cannot inject any sorts of medicine to in her life or his life. But from medical from government perspective, is there any initiative going on in Malaysia in order to have euthanasia?
I think in based what I understand before, it is according to the case 2, whereby the patient requested medication to end her life. Am I right, Dr. Nazmus, Prof. Nazmus?
Yeah, case 1, I
Yeah,
think.
yes, Nukman.
Okay.
Yeah,
So
the case number 2.
Yeah, so in this situation, what I'm talking about that in Malaysia there is a prohibition that for the doctor to end patient's life. What I've been understand before.
Is there any the
Meaning
question from the
to say
Dr.
that,
Nazmus, is there any policy or guideline? I think.
Policies.
Yeah.
Yeah, any discussion made by the governments or guidelines regarding the this issue?
Like, can we say euthanasia is accepted in Malaysia, or it is prohibited in Malaysia by force, by government?
Dr. Nazmus, can I respond to that? So according to Malaysia policy, it's not allowed in Malaysia for euthanasia, and we have CPG guidelines on pain management and also workshop series every year for pain management for our healthcare workers in hospital as well as primary care. So we adopt these guidelines to control the pain, especially for patients with an kind of life end stage of cancer, for example. So we have guidelines on this, and it's not allowed in Malaysia in terms of KKM policy. Thank you, Adan.
Thank you. That's the one I actually wanted to know, because in Islamically it is not accepted, but still in some cases they allowed it in another methodology. But Alhamdulillah, in Malaysia it is not adopted. Thank you.
Yeah, maybe Prof. I mean, Is there any question to the presenter?
Okay, thank you, Lukman, for a good presentation on Maqasid Sharia, especially when it comes to the ethics and professionalism. And then it's a common scenario. The first case, I think, actually is well accepted. I think it's a simple things that maybe we can just follow the proper communication, and then we can get through the problem. Number two actually is, yeah, I agree with Dr. Rasmus just now, is in Malaysia we don't have the law is not allowed to us to have a mercy killing, which is not allowed here in Malaysia. And then the solution that given is actually is more towards the alternatively. And then I just want to draw the attention towards the spiritual as well as the emotional motivation, which is a part of the treatment can be given to this kind of a patient. Um, and the medication given is according to the severity of the pain. And then in terms of the hopeless in life, that is actually is also something we have to talk about, because this is a part of us as a doctors, as the provider, the treatment provider. We not only actually is deal with the death, but we also have to deal with the iman. Means that we also have to take care of the patient with the passionate. Okay, and then use the spiritual care approach that you have mentioned in the case number 3 just now. That is my concern about the second case. The third case actually is mainly because of the management of to be according to the pain scope, according to the ladder of the disease itself. But I'm not sure about the COX-2 inhibitor, but COX-2 inhibitor in particular, not many people want to give it for a very long time because of the complication, not only because of the kidney failure, but also they have a tendency to get some sort of the used to the drugs and then become resistant to the drugs later on. Then they need to have a go to the other drugs. And but this case actually looks like much of pain, but the patient requests to be given the higher rank of analgesic. Am I right? If I'm not mistaken for this issue. And then is as a
Yes,
doctors, as a this one, the ethical issue here is we have to judge the patient properly. Clinical decision must be correct, and then also we have to be appropriate in terms of managing the patient. In other words, we are responsible, and then we have to put the balance and justice in terms of the treating the patient. Then come to the what is ethical or not ethical to give us something which is not appropriate to the patient. Okay, I think that's all my comment. I think it's good. Congratulations.
Thank you, Prof. Amin, for the comments. I think is there any other panel that want to comment? Okay, if there is no more, thanks Dr. Nukman for the presentation just now. Okay, so we should proceed to our last group. Okay, we have a group 14. This group is being supervised by Dr. Taufik Hidayat. So the group 14, we talk about the vaccine refusal, the common reason of the vaccine refusal in Malaysia, and also the key scenarios. I would like to welcome group 14.
Hi, good afternoon. My name is Suharsan. I'm trying to actually put in the share screen. Just bear for a minute. Can everyone see my slide?
Not yet. Yeah, it's not coming out yet. Okay. You can change to the slideshow.
Yeah, I think it's a bit slow. Okay, all right. Okay, a very good afternoon. My name is Suharsan. I'll be presenting the first half of the presentation for Group 14 and followed by Dr. Anas. So my topic will be on vaccination. Everybody can hear me, right?
Yes.
Okay,
Yes,
so
Dr. Suharsan.
yeah, so our supervisor is Dr. Taufik, and we are going to touch a bit on vaccine refusal, the reasons for the vaccine refusal, and a case-based scenario. So I'll begin with the introduction. Immunity is the ability of the human body to tolerate the presence of material indigenous to the body, like self, and to eliminate foreign, like non-self materials. Immunization is a procedure a person is made protected or resistant to an infectious disease. Vaccine contain antigens that stimulate the immune system to produce an immune response that is often similar to that produced by the natural infection. So there'll be two types of vaccines, which will be comprising of live attenuated and inactivated. Live vaccines are derived from wild viruses or bacteria. So these wild viruses or bacteria are attenuated, whereby they are weakened in the laboratory, for example, like measles viruses. Inactivated, on the other hand, are not live and cannot replicate. So these vaccines cannot cause a disease or even in an immunodeficient person. Inactivated vaccines include the whole cell inactivated vaccines like your polio, hepatitis A, or rabies, subunit vaccines like influenza, pneumococcal, toxoids like diphtheria and tetanus, and recombinant vaccines like hepatitis B and HPV and a different type of influenza. So when it comes to vaccine refusal, there are various factors that can lead to reluctance and refusal too in Malaysia. Some studies found that even well-educated, higher income individuals are more likely to refuse vaccines. Some trust that the side effects of vaccines are more extensive than what their doctors tell them, and that the risk overshadows the benefits of vaccinating. Overwhelming fears, uncertainties, and misleading new information in media, like our social media now, all contributes to decreased vaccine confidence. Lack of scientific clarification of the etiology of the various diseases exacerbates further the negative impression of vaccines. So let's look into the causes why people would actually refuse vaccination. First will be misinformation or mistrust. There'll be the religious and cultural beliefs, the perceive of being it as a low risk, underestimating the disease severity, the concerns about the side effect, and the lack of trust in our health authorities. So I'll start off with the misinformation and mistrust. One of the primary drivers of vaccine refusal in Malaysia is the widespread dissemination of misinformation that results in mistrust about vaccination, often spread through social media platforms where false claims about vaccine safety and efficacy can gain traction. Myth that vaccines cause severe side effects such as infertility, autism, or even death, despite robust scientific evidence to the contrary. Additionally, there are also misbeliefs that vaccines contain harmful substances such as microchips or even toxic chemicals that was being spread during our COVID vaccination. These misinformation are often propagated by individuals or groups with anti-vaccine agendas, further amplifying the public fears. Mistrust in the intentions and transparency of the government and the pharmaceutical companies also play a significant role. Some populations suspect that the government is not fully transparent about the safety and the efficacy of vaccines, possibly believing that the side effects are being downplayed and the vaccines were rushed through the development without proper testing, to be specific, like our COVID vaccination again. And often a general distrust in the motives of pharmaceutical companies, with concerns that profit motives might overshadow the public health and safety. So let's talk about the religious and cultural beliefs. In Muslim country, one of the foremost concerns revolves around the perception that certain vaccines may contain haram or forbidden substances according to Islamic law. Apprehensions about the use of gelatin derived from pigs or cells from aborted fetuses in the production of some vaccines. prevalent among devout Muslims who strive to adhere strictly to halal, which is permissible dietary and lifestyle practices. Some individuals may prioritize traditional or alternative medicine over modern vaccines, believing that the natural remedies or spiritual healing practices are effective or even safer. Cultural preference for traditional medication that can stem from a long-standing practices passed down through generations, creating a deep-rooted skepticism towards Western medicine or even herbal medicine. So when people actually perceive as a low risk, why? Because there has been historical success on vaccination programs, their lack of visible disease prevalence, and misunderstanding on herd immunity. So let's talk about the historical success of vaccination programs. So the widespread success of vaccination campaigns over the decades has drastically reduced the incidence of many infectious diseases. Diseases like measles, mumps, rubella, or even polio have become so rare that in some cases, virtually eradicated in certain countries. This success, while a public health triumph, paradoxically contributes to the sense of complacency. People are less likely to fear the diseases they have never encountered, leading to the belief that these diseases no longer pose a significant threat. When you have a lack of visible disease prevalence, for younger generation, vaccine-preventable diseases are a distant memory or a non-existent concern. They have grown up in a time where these diseases have become controlled or eradicated. So a lack of personal or communal experience with these diseases contributes to a diminished perception of the severity or the relevance. Next, misunderstanding of the herd community. So when it comes to herd community, they protect a population when a high percentage of individuals are vaccinated, thereby reducing the spread of the contagious disease. But many people misunderstand this concept that they believe if most others are vaccinated, they themselves do not need to be. So when too many people adopt this mindset, it compromises the immunity to the community, including those who cannot be vaccinated due to the medical conditions. So underestimating the disease severity, general lack of awareness about the potential severity and complications of vaccine-preventable diseases. For example, like influenza is often underestimated despite their potential to cause severe illnesses and fatalities, particularly in vulnerable populations such as the elderly, infants, and those with chronic health conditions. And of course, the concerns about the side effect. Significant factors contributing to vaccine refusal is because of this, whereby the fear of adverse reactions, whether real or even perceived, can deter the individual from getting vaccinated. These fears are often fueled by misinformation, anecdotal reports, and lack of understanding about the nature and frequency of the vaccine side effects. Let's talk about the fear of the adverse reaction. Many individuals worry that the side effects of vaccine, which can range from mild, common reactions like soreness at the injection site, fever, fatigue, to more severe, though rare, adverse effects such as allergic reactions and neurological conditions. Fear of these reactions can be a powerful deterrent, particularly in individuals who are not informed about the relative risk. Fear of the severe side effects, even if it is extremely rare, often outweighs the perceived benefits of vaccination in the minds of some individuals. This fear can be exacerbated by personal experience or hearing about the adverse reaction, which can seem more immediate than a real statistical data. And media coverage, which is very well covered now. Media coverage can also play a role in shaping perceptions of vaccine safety. Sensational stories about adverse reaction, especially those involving children or resulting in severe outcomes, are likely to receive extensive coverage. This can create a skewed perception of the risk associated with vaccines, as positive stories about vaccine efficacy and the prevention of the disease do not receive the same level of attention. The media's focus on the controversy and rare adverse events can overshadow the overwhelming evidence supporting the safety and benefits of vaccination. And lack of trust in health authorities. A lack of trust in health authorities or pharmaceutical companies can further amplify concerns about vaccine side effects, past medical scandals, perceived conflicts of interest, and even rapid development and deployment of vaccines can contribute to lack of trust. Many people doubt the motivations behind the vaccination campaign, suspecting that profit or political agendas are prioritized over public health. So this distrust can lead to individuals to question official information about vaccine safety and efficacy, making them more susceptible to misinformation. So I'll pass on to my second presenter to proceed from this. Thank you.
Bismillahirrahmanirrahim. Am I audible to everyone? Hello. Okay. Before we were given two clinical scenarios, but before we before we answer the two clinical scenarios, we have to understand the Islamic rulings on these vaccinations. Basically, in simple words, Islam promotes or emphasize on the preservations of life and the prevention of the harams. So based on these principles, based on these facts, we have the vaccination, which is to protect not only to protect individuals and community, but as well to protect the communities from infectious disease. Therefore, vaccinations is in line with the Islamic principles. But there are, we have the next slide, please? But what happened is when the concern is when there is, sorry, can we have the next slide? Okay, the concern is that when we are using the impermissible items, which is the vaccines contain haram materials, that the community are very concerned about. So to answer that, we have to actually goes back to the essence of its contents. So in this scenario, we have three scenarios, which is the first one where the materials are made, the vaccines are made from clean and pure materials. So if that is made from clean and pure materials, there's no doubt it is halal, it is harus. But it becomes something debatable when it is made from haram materials. Can we have the next slides? It is divided into two perspectives. The first one is it is made from impure materials, haram materials, but there is an alternative for the vaccines. So when this is the case, therefore it is prohibited, because sabda Rasulullah sallallahu alaihi wasallam, sesungguhnya Allah telah menurunkan penyakit dan penawar, dan ini telah menjadikan bagi tiap-tiap penyakit itu penawar, maka kamu semua berubatlah dan janganlah kamu semua berubat dengan perkara-perkara yang haram. So therefore, no doubt it is important for vaccination, but if there's an alternative, therefore we should opt for the one that is use of halal materials. But there is in conditions where there is no alternative, this fall into the category of darurat, which falls into allowed, which permissible by principles. So, however, can I have the next slide? The certain conditions has to be met before we can label that condition is darurat. First, the darurat really happens. It means that yes, there is ongoing or destructions of life or property, such as what we can see in the COVID-19 previously. There are destructions towards our life. There's a lot of people died because of the COVID-19. There is an immediate threat to our life and as well as the property. But some people may argue, I do not have to take vaccines because getting infected from the COVID-19 is just based on the assumptions. I may not be eventually be infected by COVID-19, but this, if it is based on assumption, the assumption should be strong assumption that has gone through the process of experience and observation. That is again example in COVID-19 previously. There's data, there's a lot of data, and we as the healthcare professionals, we've witnessed a lot of people pass away in front of us because of the COVID-19. So it is considered darurat already. Second, there is no other way allowed by the Sharia to avoid the harm. So like I said, there's no alternative, there's no way for us, then it is considered as darurat. Third, we have just do it as much as is necessary. So when the use as appropriately as necessarily, but when the threat is over, we should be reconsider it back. And the fourth one is it must be recommended by a doctor who is trusted in religious belief and practices and has expertise. So if for COVID-19, you should trust those who has the expertise in that, not just some from layman person. So based on that, we can answer the scenario that is given to us. So the first scenario, one of your medical staff refused for COVID-19 vaccine. How would you respond? So to respond this, can I have the next slide? again, like been mentioned by Prof. Amin in the morning, we should be professional and ethical in a professional and ethical manner. We should find a common grounds to address the concern of the patients, of the patients, why the staff refused for vaccination. What is his concern? His or her concern. We have to try to debunk any myth that may be concerning to the staff. And we can explain all the risks and benefits if the staff refuse for vaccination. And after all the explanation, like mentioned by Prof. Amin earlier this morning, the patient has his own rights. So despite of all our efforts, if the patient is refused, then we have to respect the decision. But the key factor is educate. We should find the right spokesperson, and we also should emphasize the ethical responsibility for the patients. Meaning here is that Meaning here is that taking vaccination is also a ethical responsibility, not just for the patient, for him or herself, but also for the community at large. Because by not taking the vaccination, he or she may be get infected, and he or she can actually transfer it to other community members who are not able to take the vaccination, such as elderly and children. Next slide, please. But another thing that we can point at in managing such cases is that in Islamic principles, we can mention that Islamic principles in dealing with illness, there are 4 components. First, pray to Allah SWT. Second, prevention. Third, treatment. And last but not least is tawakkal. So, in terms of praying, yes, we should pray that we would not get infected. Can I have the next slide, please? We pray that, we aim that Allah not get us the disease. And prevention, the second principle is the prevention. Islam emphasizes the prevention of disease. Not only in COVID, not only in vaccination, we are also, the vaccination is part of the prevention, but not only in vaccination. For example, in dengue, we should emphasize on the clean environment, because Islam emphasizes on this prevention of disease, such as in Hadith Al-Bukhari that stated, narrated by Abdullah bin Amir, Umar went to the Shams, and when he reached Sakh, he got the news that an epidemic of plague had broken into Shams. Abdurrahman bin Auf told him that Allah Messenger, peace be upon him, said, if you hear that the plague has broken out inland, do not go it. But if it breaks out inland where you are present, do not go out, escaping from it. Meaning here, if you're inside it, don't go out. If you're outside, you're not exposed yet, do not go in. So this is the gist of our public health today. So the third component is the treatment. One person is afflicted with an illness, Islam emphasizes the importance of treatment. In addition to being satisfied with what has happened, we are actually demanded to treat the disease and should not be ignored. This is based on another hadith narrated by Usamah bin Ibn Sharik. I came to Prophet and his companions were sitting as they had birds on their heads. I saluted and sat down. The desert Arab then came from here and there. They asked Messenger of Allah, should we make use of medical treatment? He replied, make use of medical treatment, for Allah has not made a disease without appointing a remedy for it, with the exception of one disease, namely old age. So based on these 4 principles, and the last principle is the tawakkal. After all that we have done, we should actually leave all the subsequent matters to Allah SWT. So when dealing with illnesses, we should adhere for these 4 basic principles. You cannot just accept the last component, which is tawakkal, and only accept that. We have to take all the principles. Pray, we should try to prevent, treat if we have already get the disease, and after we have attempted the medications and leave it to the matters to Allah SWT.
Okay. Sorry, Dr. Anas. Dr. Anas only have around maybe 3 to 4 minutes.
Okay.
Finish
Last
up.
one
Okay.
is regarding the your staff nurse referred to you a case of misimmunization of about 11 months old boy. So the parents refused because opted for natural immunity. How would you respond and advise to the parents? So since 9 months, so basically the patient, their family members already refused the MMR vaccination. Next slide, please. So what is MMR vaccine? The MMR vaccine is a safe and effective combined vaccine. The MMR vaccine is a single injection that is administered into the thigh of young children or upper arm of the children, older children or adult. It is live vaccine, which means that it contains weakened version of measles, mumps, rubella virus. This has been weakened enough to produce immunity without causing disease. Next slide, please. So it is 2 doses for 3 infections. Basically, it's 2 doses for 3 infections. Can we have the next slide, please? So according to the literature, the effectiveness is very good. For measles, it's about 99% protection, while for about mumps is about 88%. So how do we go about? Next slide, please. We first, again, back to our ethical and professionalism. Establish a report. Ask about the backgrounds of the parents, and we should assess what is the mother's concern on board. What is the patient's? What is the parents afraid of? What is the source of their information regarding vaccinations? Is it from a reliable source or not? And what are the any prior history of vaccination problems? In fact, it can actually, the refusal may because of the patients or the baby's previous allergic reactions toward the vaccination, causing the parents to be afraid of, or even the children has medical problems that make the patients become contraindicated for vaccination. Next slide, please. So then we should inform all the benefits of the vaccination, the Islamic rulings of it, and last but not least, if the patients still refuse, we should respect that and sign an AOR. Nonetheless, we should actually give a template, keep an eye on them. So meaning we cannot refuse treatments to them if they will be infected with measles and mumps rubella. This is just related to MMR vaccination. There are parents that are concerned that MMR vaccine causes autism, but again, it has been debunked because the Andrew Wakefield has multiple undeclared conflicts of interest and manipulated the evidence. The writer itself has been deregistered to and can no longer be practiced. We can actually inform to the parents. Next slide, because of limited time. So next slide, please. Okay, so the Islamic divine law, we should we should follow the Maqasid Sharia because the vaccination follows the principles of the Maqasid Sharia, preservation of deen. So because of using this vaccination, it enhanced the Muslim health. It preserved the religion. It preserved the nafs. It preserved the akal. It preserved and as well preserve our wealth as well. Therefore, vaccination is actually fulfill the Maqasid Sharia goals. Next slide. So again, I already mentioned this hadith before. It is in line what is being asked by Prophet Rasulullah. We should actually try to make treatments and prevent illnesses. I think the last slide. Can I have the next slide? It is worth emphasizing that that Islam is strongly advised to pursue medical care and medication as evidenced by the mentioned hadith. Therefore, vaccination as a preventive measure is deemed acceptable and encouraged in Islam. The act of receiving a vaccination prior to the occurrence of an outbreak aligns with an Islamic fundamental that promotes the preservation of good health. With that, thank you.
Thank you, Dr. Anas, for the comprehensive presentation, I think. Okay, so I would like to call our expert panel to comment and maybe give some question to the presenter.
Assalamualaikum. Actually, let me just give my opinion here. I would like to congratulate, and I'm really happy for the presenter to have kind of comprehensive presentations. Few issues. The hadith, the incident that he referred, this is the excellent reference in order to deal today's contemporary issues. But when we see deeply actually on that incident, when Omar was about to go, and finally he did not go after the shura, and one of the companions said that, okay, we have this hadith. But here, when he came back and he wrote a letter to Abu Ubaidah to come back. So Abu Ubaidah didn't respond to that. And he stayed and died, followed by Abu Zar. So here I have a bit, because we had this vaccine resistance seminar before me and Dr. Saiful was there. Here, if we say that we need to respect the personal view, then there will be a fitna. What happened in Canada as well during COVID. So, Atiullah, Ati Rasulullah, Ulil Amri Minkum, here government plays a great role in order to have the public, in order to preserve the public interest. So, as you concluded at the last point that Islam highly encourage. So this should be the final conclusion of this vaccine residency for vaccines issues. Because, you know, if we allow that, okay, I respect your view, okay, we will not give it. The problem is he will spread it. He will say, he will, you see, I have done it. I did not take, I am okay. So this is some misinterpretations, you know, this is the kuffar thing. They are altering our DNA. So many things happen in these vaccine issues during COVID or in other issues. So for me, I think for vaccine, as long as it is certified for fiqh issues, I am not going to that. But as long as it is recommended by the government, I think the medical doctor should have this position that no, rather than discouraging, no, you have encouraged people to take the vaccine. And I really appreciate the presentations, and by referring that incident of plague, thank you. I really appreciate it. I would like to go with the conclusion of this presentation that Islam highly recommend of taking the vaccines or the following the ruler of the government. Thank you.
Thank you again, Nazmut. I think, is there any other panel comment? Can we have a Prof. Razak here? I think maybe Prof. Ibrahim want to talk something, Prof. Ibrahim? Yeah.
Okay, thank you. I believe issue of vaccination is a serious matter, especially when we go back a little bit to the time of COVID-19 time. Many didn't willing to take the vaccination. Maybe sometimes due to cultural and religious perspective, but also sometimes due to the vaccination background, which is I'm not sure, is it just matter of business purposes and so on. So to address this issue, I believe it is very important, and to create different scenarios to deal with it also very important. Therefore, the main issue which you need to address is a rejection of the vaccination due to the religious basis. Of course, your conclusion say Islam encourage taking vaccination, but in fact, if we make any survey, majority of those who rejected the taking vaccination are Muslim, among Muslim. Among UIA also, I remember many of my close friends also, they're not willing to take this. So we need to address this issue properly to make sure your conclusion is effectively taken. So I hope no outbreak happen, but in case if outbreak happens that we need to take the vaccination, I think we should not face any difficulties as Muslim based on religious background or religious purposes. So thank you very much. I think already time is very late. We are very sleepy. We didn't pray yet also.
Yeah, Prof, it's lunch hour.
Yeah, this group, I think they will present very well, but as I mentioned, we lost energy and also we have no ability to discuss more. So I stop there. Thank you very much.
Thank you so much, Prof. Ibrahim. I think, yeah, you did a good job, Dr. Suhasan and also Dr. Anas. Maybe because it's lunch hour, so not much question from our expert panel. So I think we should end our program today. Before that, is there any comment or any maybe question or constructive feedback from others participants and also from the IOHK members? If anyone want to talk something before we end the session, I would like to open to all the participants. If do you have any question, any comment regarding our seminar today?
Maybe I can say, Dr. Ashiki, thank you very much. I'd like to thank everyone, our beloved speakers, our participants, expert panels, all the students. Thank you for joining until day 2 up to this hour. I know it's quite difficult to combine every information in 1.5 days, but Alhamdulillah, we managed to do it online this time. And we apologize for transforming the session to online because of some reason by the participants. I just would like to remind everyone to click on the chat box in terms of the link. They're already been shared, the link for feedback and certificate as well as CPD points link. So I hope everyone can able to find the information in the chat box, and please log in into the form and we will submit your names for the CPD points. I would like to apologize for any shortcomings from our team. I know that there's a lot of things that we need to improve, but I hope that this session is benefit all. Our aim is not to Islamize everyone. It's not to Islamize the things. It's basically just to share information. Hopefully with the information, we can be a better professionals in our career. Thank you very much, Dr. Asikin, everyone.
Thank you, Dr. Saiful, as a chairman of our seminar today. So before we end the session, I would like to invite Assistant Prof. Dr. Muhammad Iman binti Saiful Sohadi to recite the doa before we end the session.
Thank you, Madam MC. Bismillahirrahmanirrahim. Alhamdulillah Rabbil Alameen. Wassalatu wassalamu ala ashrafil anbiya wal mursalin wa ala alihi wa sahbihi ajma'in. Allahumma innaka khallaqul azim. Innaka sami'un alim. Innaka ghafurur rahim. Innaka rabbul arshil azim. Innaka al-barrul jawadul karim. Allahumma ya karim ya rahim. Ya fa'alun lima yurid. Rabbana alayka tawakkalna wa ilayka anabna wa ilayka al-masir. Rabbana atina fid dunya hasanah wa fil akhirati hasanatan wa qina azaban nar. Subhanakallahumma hamdika asyhadu an la ilaha illa anta astaghfiruka wa atubu ilaik. Subhanakallahumma bihamdika asyhadu an la ilaha illa anta astaghfiruka wa atubu ilaik. Subhanakallahumma bihamdika asyhadu an la ilaha illa anta astaghfiruka wa atubu ilaik. Bismillahirrahmanirrahim. Wal 'asri innal insana lafi khusr illa alladhina amanu wa 'amilus salihat wa tawasaw bil haqq wa tawasaw bis sabr. Wa sallallahu ala sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. Walhamdulillahi rabbil alamin.
Amin amin rabbana alamin. Thank you so much, Dr. Muhammad Iman, for the doa recitation. So I think we end our session today. with Tasbih Kifarah and Surah Wal As. And then before that, don't forget to fill up the platform and also CPD point link for all the doctors join today's. I think until we see again, maybe a next batch. It's not you all. Next batch, we see for the seminar IMP next year. Inshallah, we want to do the face-to-face next year, Dr. Saiful. Is it? Yeah, I think that's all. Thank you everyone for joining us. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullah.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you.
جئت بعد العسر يسرا ربنا أعلاك قدرا يا إمام الأنبياء أنت في الوجدان حي أنت للعينين ضي أنت عند الحوض ري أنت هاد وصفي يا حبيبي يا محمد يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يرتوي بالحب قلبي حبي خير رسل ربي من به أبصرت دربي يا شفيعي يا رسول الله أيها المختار فينا زادنا الحب حنينا جئتنا بالخير دينا يا ختام المرسلين يا حبيبي يا محمد يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يا نبي سلام عليك أجرا جئت بعد العسر يسرا ربنا أعلاك قدرا يا إمام الأنبياء أنت في الوجدان حي أنت للعينين ضي أنت عند الحوض ري أنت هاد وصفي يا حبيبي يا محمد يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يرتوي بالحب قلبي حبي خير رسل ربي من به أبصرت دربي يا شفيعي يا رسول الله أيها